This nerve, this is the inferior alveolar nerve, enters into the mandibular foramen, emerges out as a mental nerve. Okay, this is the trigeminal ganglion. Okay, fine. Now, this is the maxillary nerve which continues out as infraorbital nerve. That's the stylar process of the temporal. So yesterday we were discussing HFM, head and neck. Today we'll continue with it. Okay, fine. This nerve is the mandibular nerve. Hello? क्या हाँ पंखा चल रहा है वो बंद कर दो अभी फिलहाल पंखा चालू है बंद कर दो वापस करते हैं हाँ बस वापस चालू करो ओके फाइन So look at this. We were discussing the head and neck yesterday. Okay. So this nerve is a mandibular nerve, and the mandibular nerve gets out through the foramen ovale. This branch of mandibular is known as lingual. This is the inferior alveolar nerve. The inferior alveolar nerve gives a branch here. What is this branch known as? This is the nerve 2. Mylohyoid, which supplies the mandibular nerve, and the mandibular nerve gets out through the foramen ovale. This branch of mandibular is known as lingual. This is the inferior alveolar nerve. The inferior alveolar nerve gives a branch here. What is this branch known as? This is the nerve 2. Mylohyoid. Clear to all of you? Following this? These are the upper teeth. These are the upper teeth, these are the lower teeth. Good morning to all of you. Good morning to all of you. Starting with the anterior triangle of the neck. Okay, so you're clear about the posterior triangle. Posterior triangle is clear to all of you. Starting with anterior triangle. Have a look at these muscles. Okay. What are the muscles in the anterior triangle? I'm starting here. Just have a look. Muscles in the anterior triangle of the neck. Now this muscle begins from the manubrum sterni, from the sternum, manubrum sterni. And this muscle is attached to the hyoid bone. Have a look at this. A muscle which begins from the manubrum sterni attached to the hyoid. This is the hyoid bone. And this muscle is the sternohyoid. Sternohyoid. We remove the sternohyoid and there's a muscle deep to the sternohyoid. What is this? See, this is the sternohyoid which is cut here, right? That's the sternohyoid. We cut the sternohyoid. What is this muscle? Sternothyroid. Sternothyroid. This is a continuation of sternothyroid, that's thyrohyoid, and this muscle is the omohyoid, okay, fine. So you tell me, the sternohyoid and sternothyroid, where have you come across this? Remembering sternohyoid, sternothyroid, They are attached to the manubrium sterni. They belong to the superior mediastinum also. So what are the contents of superior mediastinum? Sternohyoid, sternothyroid and thymus. Superior mediastinum ka anterior compartment. Remembering sternohyoid, sternothyroid and thymus. So which are the strap muscles here? Sternohyoid, sternothyroid, thyrohyoid and omohyoid. So these are the strap muscles. Just listen to this. What is the nerve supply of this muscles, which is very important? Okay, look at this now. See this. What is this big vein here? The deep vein in the neck. What's that? Internal jugular vein. Okay, so that's internal jugular vein. This internal jugular vein, remembering how it is formed? Internal jugular vein, the embryology of internal jugular vein. It is derived from anterior cardinal vein above the attachment of subclavian vein. Remembering that development of veins. Anterior cardinal vein above the attachment of subclavian vein. That was internal jugular vein. So that's the internal jugular vein. Along with the internal jugular vein is this artery here, internal carotid artery. With them is a nerve here. You can see this nerve here. Yeah, that's the vagus nerve. Vagus. So internal jugular vein, internal carotid artery and the vagus nerve, they are enclosed in a sheath like this. What is that sheath known as? Carotid sheath. Carotid sheath. Okay, so when we say contents of carotid sheath, normally we say internal jugular vein, the internal carotid artery and the vagus nerve. But remember, at the base of the skull, the last four cranial nerves, 9th, 10th, 11th and 12th cranial nerves are within the carotid sheath. Okay, so if you see the base of the skull, contents of carotid sheath will be internal jugular vein, internal carotid artery and the 9th, 10th, 11th and 12th cranial nerves. Remember that. Okay, so this was an MCQ which was asked recently in the recent exam. Fine. So normally when we say carotid sheath, what are the contents of carotid sheath? The common carotid artery first lies in the carotid sheath. The common carotid artery divides into an external carotid and internal carotid. The external carotid is going to pierce the carotid sheath and get out. So who will remain in the carotid sheath? Internal carotid artery. So when we say contents of carotid sheath, it would be common and internal carotid artery, internal jugular vein and vagus nerve and the last four cranial nerves. Okay. So now if you see the anterior wall of carotid sheath, look at this, you find a loop here. What is this loop known as? A loop is known as ansa. Ansa is a loop formed in the neck, cervix. Ansa cervicalis. Now what is ansa cervicalis? How it is formed and what it supplies. Okay, this is what you have to know. Very important. Starting with muscular triangle. Anterior triangle, because this is muscular triangle. Start with me. Muscular triangle. Starting with muscular triangle. Tell me now, what are the muscles here in the muscular triangle? Fine. Muscles in the muscular triangle. Starting with muscular triangle. 1. Sternohyoid. 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 Second, sternothyroid. Sternohyoid, sternothyroid. Third, thyrohyoid. And fourth is omohyoid. So these are the muscles in the muscular triangle. Here, sternohyoid, sternothyroid, thyrohyoid, and omohyoid. Now, what is the nerve supply of this? Ansa cervicalis. See, remember omohyoid, the superior belly, inferior belly. Inferior belly was lying in the posterior triangle. The inferior belly of omohyoid divides the posterior triangle into an occipital triangle and a supraclavicular triangle. And the superior belly was lying in the anterior triangle, which was dividing the anterior triangle. Okay, those boundaries and all you know. Now, I'm starting with ansa cervicalis. Okay, starting with ansa cervicalis, have a look. Understand this. Ansa cervicalis. What is ansa cervicalis? How it is formed? Look, ansa is basically a loop. It's a loop like this. And to form a loop of a nerve, you need two nerves. We need two nerves, and these two nerves will come and join to form a loop. Now what are these two nerves, where they come from, and how they join to form a loop? This is what you have to know. Okay, starting with this. Now this is the hypoglossal nerve which is going to supply the tongue. Hypoglossal nerve. This is C1, C2, C3. C1, C2, C3. Okay, I'm starting. Look here. Fibers of C1 go with the hypoglossal nerve. Just listen to this now. If you're late, it's fine. Just be with me. I've just started. Fibers of C1, they go with the hypoglossal nerve. After a short distance, they leave the nerve as one, the meningeal branch. Second, nerve to thyrohyoid. Nerve to thyrohyoid and genohyoid. Thyroid and genohyoid. So if you get an MCQ stating nerve supply of thyroid and genohyoid, your answer is going to be C1. C1. Nerve supply of thyroid and genohyoid, C1. Okay. So fibers of C1, they go with the hypoglossal nerve. After a short distance, they leave the nerve as one. This is the meningeal branch of C1. Meningeal branch. Second is nerve to thyrohyoid and genohyoid. Thyroid and genohyoid. And the third branch is descending down. This is what we call as the descending hypoglossal. It is nothing to do with the hypoglossal nerve. Remember, these are the branches of C1, but this branch is descending down from the hypoglossal nerve. It is therefore known as the descending hypoglossi, or it is known as the superior root cervicalis. Okay, so we have got one root now, superior root of ansa cervicalis. Where does it come from? C1. Now C2 and C3 joins to form. Here. This is descending down from the cervical part of the spinal cord. We call this as the descending cervicalis, or this is ansa cervicalis, inferior root of ansa cervicalis. So that's the inferior root of ansa cervicalis. That's the superior root of ansa cervicalis, and this is the loop now. This loop is known as ansa cervicalis. Clear to all of you? So ansa is basically a loop which is formed by C1, C2, C3. Fibers of C1, they come down with the hypoglossal nerve, known as descending hypoglossi or superior root of ansa cervicalis. C2, C3 joins to form the descending cervicalis, and this loop is known as the ansa. And what are the branches from this loop? This is the nerve to sternothyroid, and superior belly of omohyoid. I've just started. So this becomes an answer. Okay, we'll start. Okay, have a look. So I'll just make this slide once again for you. This is what we were discussing. This is the lesser wing of sphenoid. That's the lesser wing of sphenoid. That's the pitchous part of temporal bone. That's the body of the sphenoid. This becomes a middle cranial fossa. So the lesser wing of sphenoid and the pitchous part of the bone divides the skull into three fossae. This what I'm drawing now is the anterior cranial fossa. Anterior, that's the middle, and what's this fossa? That's the posterior cranial fossa. Posterior. This is the foramen magnum. This lobe is known as the clivus. This is the cribriform plate of ethmoid bone. This is the optic canal. These were the three foramens that I had drawn here for you. Just one moment, I'll start with this once again. Have a look here. Okay, what is this ganglion here? What is this ganglion known as? This ganglion is the trigeminal ganglion. Here it is, and this trigeminal ganglion is lying inside a cave of dura mater. What is that cave known as? Meckel's cave. So the trigeminal ganglion lies in the Meckel's cave. Okay, trigeminal ganglion lies in the Meckel's cave. Okay, from this trigeminal ganglion we get three branches. What is this? This is the ophthalmic division of trigeminal nerve. It enters the orbit through the superior orbital fissure. This is the maxillary division of trigeminal nerve, which passes through the foramen rotundum. That's the mandibular division of trigeminal nerve, and this is foramen ovale. Foramen ovale it is. Okay. So these are the various foramens of the skull. I just labeled this for you. One moment. So this is number 1 which I had labeled. That's the cribriform plate of ethmoid bone. This is the optic canal. What passes to this is optic nerve and ophthalmic artery. This is the lesser wing of sphenoid. And just below the lesser wing of sphenoid, there's a long fissure named the superior orbital fissure. And what passes to the superior orbital fissure? The structures which have to go to the orbit, the nerves which supply the muscles of the eyeball. So that is 3, 4, 6 and ophthalmic nerve. Fine. Now, what is this now? This is the foramen rotundum. And what passes to this? The maxillary nerve. That's the foramen ovale. We'll be discussing, I'll be writing this. This is the foramen ovale. And what passes to the foramen ovale? M-A-L-E, male. That we'll discuss now. This is number 6. This is the foramen spinosum. That is foramen lacerum. Okay. This is the petrous part of temporal bone. And there's a foramen here. What is this known as? This is the internal acoustic meatus. You know, if any structure, like who lies inside this petrous part? In the petrous part lies the middle ear and the internal ear. And if any structure has to enter the ear from inside the skull, there's a foramen there. What's that? Internal acoustic meatus. Now, who enters through this internal acoustic meatus? The facial nerve, the vestibulocochlear nerve, and the labyrinthine artery. An artery to supply the labyrinth, that's labyrinthine artery. This is the jugular foramen. This is the foramen magnum. And on either sides of foramen magnum, we have got two foramens here. Okay, what is this known as? Hypoglossal canal. You just draw this. Draw this first. I'll then start with the writing part. Okay. Draw this. Okay. That's the petrous part of temporal bone. This is the trigeminal ganglion. That's the trigeminal ganglion. Okay, just label this fast and draw this. So we'll start with this topic is interior of skull. Okay, interior of skull. This is the clivus. One moment. Clivus, hai na? Clivus. One moment. None of this is difficult to draw. This lobe is known as the clivus here. Clivus. C-L-I-V-U-S. It's a slope like this. I can't make like that on the paper, but it's a slope. And who lies on this clivus? The brainstem. Okay, the brainstem lies on the clivus, and the medulla gets out through the foramen magnum. The numbers, the foramens will be discussing. Wait, don't write anything. We'll be discussing everything. Just draw this. Don't write anything. I'll just label that for you. Now there's no place only to label. That's the transverse sinus. Oh my god, where is this gone? That's the transverse sinus. I'll just clear some parts here. You're done with the labeling, you tell me fast. Topic है interior of the skull. I'll show you the pictures, you just understand this first. Just label this part. That's a sigmoid sinus. Sigmoid sinus. Okay. So superior petrosal, inferior petrosal, sigmoid sinus. Okay, done. We'll start now. So we'll start. Starting with the labelings. Done to all of you. Yes, I have to be fast. Starting with the first one, start. Cribriform plate of ethmoid. Cribriform plate of ethmoid. Cribriform plate of ethmoid. And who passes to that? Olfactory nerves. Cribriform plate of ethmoid. What passes to that is olfactory nerves. Second is optic canal. What passes is optic nerve and ophthalmic artery. Optic nerve and ophthalmic artery. Third is the superior orbital fissure. Superior orbital fissure. What passes to this is 3, 4, 6 and ophthalmic nerve. 3, 4, 6 and ophthalmic nerve. 3, 4, 6 and ophthalmic nerve. Fourth is foramen. Foramen rotundum. What passes is maxillary nerve. Next is foramen ovale. What passes? M-A-L-E. M is mandibular nerve. Second, accessory. Accessory meningeal artery. lesser petrocellular, emissary vein, emissary vein. Next is foramen spinosum. Foramen spinosum. Okay, the next one is foramen spinosum. Now tell me, understand one thing. Now the skull is divided into three fossae, anterior, middle and posterior cranial fossa. Okay, now just understand this. Now, if any nerve lies in the cranial fossa, it is supposed to supply the meninges of that cranial fossa. That means if the nerve is lying in the anterior cranial fossa, it is supposed to supply the meninges of anterior cranial fossa. If a nerve lies in the middle cranial fossa, it is supposed to supply the meninges of middle cranial fossa, like this. Okay. So mandibular nerve lies in which cranial fossa? Mandibular nerve lies in the middle cranial fossa. So it should supply the meninges of the middle cranial fossa, right? It should supply the meninges of the middle cranial fossa. And this it should have done when it is inside the skull. So mandibular nerve should have supplied the meninges when it is inside the skull. But we don't know what happens. Somehow, it is said, somehow the mandibular nerve forgets to supply the meninges when it is inside the skull. So what does it do? The moment it gets outside the skull, okay, so the moment the mandibular nerve gets outside the skull, it remembers it has to supply the meninges. What does it do now? It cannot go up on its own. Okay, so it gives a branch here, and this branch again has to enter the skull. Now that foramen ovale is already full with MALE structures, but there's a foramen behind the foramen ovale. What's that? Foramen spinosum. The nerve is therefore known as nervus spinosus. Clear? Oh, this nerve goes in the reverse direction of the mandibular nerve. We therefore call this as recurrent branch of mandibular nerve. Oh, this nerve goes to supply the meninges. It is therefore known as the meningeal branch of mandibular nerve. Am I clear? So there are three names for this single nerve that we'll discuss later when we're discussing the mandibular nerve. Okay, so just remember this as nervus spinosus for now. So what passes to foramen spinosum? Yeah, what passes to foramen spinosum is nervus spinosus, nervus spinosus, and nervus spinosus, middle meningeal artery, middle meningeal artery. Okay, nervus spinosus and middle meningeal artery. Fine. Now you tell me. Look, how do I tell you this? I'm just thinking one moment. Tell me, you remember where is the infratemporal fossa? Infratemporal fossa, you remember? You remove the ramus, and deep to the ramus lies the infratemporal fossa. Okay. Now, what are the contents of the infratemporal fossa? You remember that plexus of veins which I showed you in the infratemporal fossa? What is that known as? Pterygoid venous plexus. Very good. Deep to the pterygoid venous plexus, there were two muscles by the name of pterygoids. What's that? The lateral and the medial pterygoid. Very good. Now, there's an artery which comes here. Remember, the external carotid artery enters the parotid gland and then divides into two terminal branches. What is this going up, straight up? Superficial temporal, and which is the other artery? Maxillary artery. The maxillary artery goes deep to the ramus of the mandible and now comes in the infratemporal fossa. So which is the artery of the infratemporal fossa? Maxillary artery. And remember something I told you about maxillary artery? Maxillary artery, maxillary artery. Yes, can you recollect? I told you axillary artery is divided into three parts by whom? Pectoralis minor. Very good. You remember subclavian artery is divided into three parts by whom? Scalenus anterior. Then I told you the maxillary artery is divided into three parts by whom? The lateral pterygoid. Lateral pterygoid. Yes. So maxillary artery is divided into three parts by lateral pterygoid. So you're getting an idea that infratemporal fossa is a difficult thing to understand. So slowly I'm entering into the topic. Suppose if you are in the infratemporal fossa, if you are right in the infratemporal fossa, and if you look out lateral, what do you see? If you look outwards, outside, or if you look lateral from the infratemporal fossa, what are you going to see? Answer this. What are you going to see? The ramus of the mandible. You're following this? Because deep to the ramus lies the infratemporal fossa. So if you are in the infratemporal fossa and if you look laterally, what are you going to see? The ramus of the mandible. And you know what is this? This is the ramus and that's the body of the mandible. What is this junction known as angle of the mandible? And you remember who was supplying the skin over the angle of mandible? The greater auricular nerve. Yes, that's a branch of cervical plexus. That's a branch of cervical plexus. There's a muscle which is inserted on the angle outside, a muscle here, and this is the masseter. You know what is this muscle here? Temporalis. A muscle which is inserted on the angle but outside is masseter. A muscle which is inserted on the angle but inside, on the angle but inside, that's the medial pterygoid. I'll show you this later. So what I want you to understand is, if you are in the infratemporal fossa and if you're looking outwards, outside, what are we going to see? The ramus of the mandible and a muscle which is inserted into the angle but on the inner side. What's that? Medial pterygoid. Medial pterygoid. Now you're following this? So from the infratemporal fossa, I look laterally, I find the ramus of the mandible and the medial pterygoid. From the infratemporal fossa, I look up. What do I see? I find the greater wing of sphenoid bone. The greater wing of sphenoid. And the greater wing of sphenoid has all these foramens in it. Yep. This is the greater wing of sphenoid. Lesser wing of sphenoid, you know, no? This is the greater wing of sphenoid. Okay. So from down, if you see, you find the greater wing of sphenoid. And you'll find two foramens in this greater wing. One is the foramen ovale and one is the foramen spinosum. Following this, you're able to follow what I'm saying? I'll explain with pictures. I'll show you the pictures, but just try to understand the concept first. First try to understand this, get your concepts clear, then see the slides, you'll be perfect then. Okay, I'll show you the pictures, just wait now, but just try to understand first. So just get a visual imagination in your brain first and then I'll show you the slides. Okay, fine. We are in the infratemporal fossa. Okay. And if you look laterally, what do we find? The ramus of the mandible. I find the medial pterygoid. From the infratemporal fossa, I look up. What do I see? The greater wing of sphenoid. I find two foramens here, the foramen ovale and foramen spinosum. And you know who comes out through the foramen ovale? Who gets out through the foramen ovale? The nerve which comes outside the skull through the foramen ovale. That's the mandibular nerve. So which is the nerve of the infratemporal fossa? Mandibular nerve. You're following this? So that's how the infratemporal fossa is. The contents would be 1. The pterygoid venous plexus, the medial and the lateral pterygoid. The nerve of this fossa would be mandibular nerve and its divisions, and the artery is going to be the maxillary artery. Okay, that's nice. See the slide and tell me. Just have a look. I'll finish that topic for you, but now just try to understand the slide. Just see this. See the slide and tell me, where are we? Okay, look, this is so nice. Just try to understand and get a visual picture in your brain first, and then you see the actual foramen rotundum goes anterior. Foramen rotundum does not come in the infratemporal fossa. Remember, foramen rotundum goes in front. I'll tell you that. Okay, what's this? Look, what was this? That's the ramus of the mandible, right? That's the ramus. That's the body of the mandible. And what is this area known as? This is the angle of the mandible. This is the angle. Okay, very good. Foramen rotundum is not seen in the infratemporal fossa. No, foramen rotundum is not seen in the infratemporal fossa. No, well, I'll tell you why. I'll tell you, just wait. So what have we done here? We've cut the ramus of the mandible. Look how nice. We've cut the ramus of the mandible, and if you see, there's a muscle inserted here outside on the ramus, on the angle. What would this muscle be? Outside is not drawn that. What would that muscle be on the outside of the angle of mandible? Masseter. So now we've removed the masseter. What is this muscle? This is the medial pterygoid. Medial pterygoid inserted on the angle but inside. Following this now? That's a medial pterygoid. And what's that? Lateral pterygoid. Okay, so that's a medial pterygoid, that's a lateral pterygoid, and there will be a plexus here. What is this plexus here? The pterygoid venous plexus. Pterygoid venous plexus. Okay, you're following this. Good. The pterygoid venous plexus. One moment, I'll just show you some slides. See, look at this slide and you tell me if you can understand this slide. Look at this slide. Look, this is so nice. Tell me now. What have we done here? What is this that is cut here? You can understand this now. What is this? Ramus of the mandible. That's the ramus of the mandible. What was the muscle here? Outside on the ramus here, on the angle here? That was the masseter. Okay, this was the masseter muscle. Fine. Now we've cut the ramus of the mandible. We've cut the ramus of the mandible, and what are we looking into? Infratemporal fossa. So that's the infratemporal fossa. What is this muscle now? Medial pterygoid. You're getting an idea now. The medial pterygoid is inserted on the angle but inside. That's a medial pterygoid. What's that? Lateral pterygoid. That's a lateral pterygoid. What's this artery? This artery is the external carotid artery. The external carotid artery, what is this branch and what is this branch? This is the superficial temporal artery. Yo, that's the superficial temporal, and this is the maxillary artery. And this maxillary artery goes deep to the ramus. Look, it goes deep to the ramus, and now this maxillary artery comes in the infratemporal fossa, and this maxillary artery is divided into three parts by this muscle here. What's that? Lateral pterygoid. You're clear? So maxillary artery, this is the maxillary artery, yes, divided into three parts by lateral pterygoid. Internal carotid, this is not internal, this is external carotid. Internal carotid is deep inside. Following now? Yes, very good. Everything is clear? Okay, we'll be discussing this later. I'm just giving an idea because now directly I can't go to this topic. So slowly, I'm building this topic for you. Okay. Okay, look at this now. Look at this slide. Clear again? Now we are in the infratemporal fossa. What have you cut here? Ramus of the mandible. So the first thing what you see in the infratemporal fossa is the pterygoid venous plexus. You know this pterygoid venous plexus? Deep to the pterygoid venous plexus are the pterygoids. On the lateral pterygoid is the maxillary artery, and one moment. And look at this now. Look at this slide. Okay, look at this slide. From the infratemporal fossa, if I look medial, okay, clear till here? Okay, very nice, fine. Now see, understand once again, infratemporal fossa. Where is the infratemporal fossa lying? It's deep to the ramus of the mandible. Now just imagine if that's the infratemporal fossa, you're in the infratemporal fossa, and if you look lateral, what do you find? The ramus of the mandible, and the muscle which is inserted into the angle, what's that? Medial pterygoid. From the infratemporal fossa, if you look up, what are you going to see? The greater wing of sphenoid, and you find two foramens here, the foramen ovale and foramen spinosum. You clear? Now from the infratemporal fossa, if you look medial, I'm looking medial now. Look at this slide. Now this is the maxilla bone, and this is the pterygoid plate. Okay, this bone is known as the pterygoid plate. So between the maxilla and the pterygoid plate, you get this fossa here, and this fossa is known as the pterygopalatine fossa. So from the infratemporal fossa, if I look medial, I'll look deep, I find this fossa here. That's the pterygopalatine fossa. Is this clear to all of you? That's the pterygopalatine fossa. So this is deep to the infratemporal fossa. You're all following this now? Yes. So contents of infratemporal fossa would be the pterygoid venous plexus, the lateral and the medial pterygoids, the maxillary artery, and the mandibular nerve. Contents of foramen spinosum, no? Nervus spinosus and middle meningeal artery. Okay, clear to all of you? Now see, just have a look at this. What is this? What is this ganglion here? That's the trigeminal ganglion, and this trigeminal ganglion would be covered by dura mater here. It forms a small cave here. What's that cave known as? Meckel's cave. Now what is this 1? What is this 2? And what is this 3? Tell me. 1 is the ophthalmic division. 2 is maxillary division, and 3 is mandibular division. Mandibular division. Okay, fine. So the ophthalmic division, what is this that you're looking at? What is this? This is the lesser wing of sphenoid. So the ophthalmic division enters into the superior orbital fissure, and the ophthalmic division comes to the, this is the orbit. This is a section of the skull. You're following a section. So the ophthalmic division enters inside the orbit. What is this nerve? This nerve. This is the maxillary nerve. What is this foramen here? Look at this foramen here. That's the foramen rotundum. Foramen rotundum, and the maxillary nerve enters directly into this fossa. You're clear now? It is deep to the infratemporal fossa. This fossa is a pterygopalatine fossa, and that is why you do not see the maxillary nerve in the infratemporal fossa, because the maxillary nerve leaves the skull through foramen rotundum. The maxillary nerve directly enters into the pterygopalatine fossa. You following now? Yes, no? The maxillary nerve enters into the pterygopalatine fossa, and the maxillary nerve goes straight and emerges just below the orbit. There's a foramen here named the infraorbital foramen. The nerve is now known as what? The infraorbital nerve. So infraorbital nerve, you remember infraorbital nerve, we had drawn that sensory nerve supply of the face. Here the nerve which drawn below the orbit was infraorbital nerve. And this infraorbital nerve is nothing but a continuation of maxillary nerve. It's a continuation of maxillary infraorbital nerve. Fine. Is this clear to all of you? So maxillary nerve continues as infraorbital nerve. You got an idea about infratemporal fossa now at least? Okay, good. Okay. Now coming back to this. Fine. So where are we now? So foramen spinosum, what passes is nervus spinosus and the middle meningeal artery. 7 is foramen lacerum. Foramen lacerum, what comes is internal carotid artery. Just be fast. Foramen lacerum, the structure which comes in is internal carotid artery. Internal carotid artery. Okay, that's good. Internal carotid artery. Next 8 is internal. I'll repeat that later. I'll repeat that once again. Internal. 8 is internal acoustic meatus. Internal acoustic meatus. And what passes to this internal acoustic meatus? The 7th nerve. 7th nerve. 8th nerve. And labyrinthine artery. 7th nerve, 8th nerve, and the labyrinthine artery. Okay, 7th nerve, 8th nerve, and labyrinthine artery. I'll tell you that infratemporal fossa. 9. Next is 9. 9 is jugular foramen. Jugular foramen. Jugular foramen, there are 3 compartments: anterior, middle, posterior. Anterior, middle, and posterior compartment. Okay. Now just try to understand this. Look at this slide. Okay, look. Sinuses of the skull is a different topic. We'll be seeing that later, but I'm just telling you this. What is this sinus? Have a look at this. What is this sinus? This is the transverse sinus. Transverse sinus. The transverse sinus then becomes an S. And what is this S known as? Sigmoid sinus. And the sigmoid sinus now gets out through the posterior compartment of the jugular foramen. It is now outside the skull. It is now known as the internal jugular vein. Okay. Sinuses will be discussing later. But you know, internal jugular vein is a continuation of what? Sigmoid sinus. Okay, so that's internal jugular vein. Deep petrosal nerve. Yes, deep petrosal nerve also you can add there. Deep petrosal nerve. I'll tell you. Now, what is this bone? What is this bone? This is the vitreous part of temporal bone. Vitreous part. And the spictrous part has got two borders. One is the superior border, one is the inferior border. There are two sinuses here. One is the superior petrosal sinus and the other one is the inferior petrosal sinus. Superior and inferior petrosal sinus. Okay. Now this inferior petrosal sinus gets out through the anterior compartment of jugular foramen. So what gets out through the anterior compartment of jugular foramen? Inferior petrosal sinus. Okay. You can add here foramen lacerum, internal carotid artery and the deep petrosal nerve. You can add the deep petrosal nerve here. Internal carotid artery and the deep petrosal nerve. Okay, fine. Laryngeal branch of ascending pharyngeal artery, that's also there. You can add the deep petrosal nerve. Yes. Fine. So what passes to the jugular foramen? Your anterior compartment is the inferior petrosal sinus. Inferior petrosal sinus. Posterior is sigmoid sinus. This is very important. Sigmoid sinus. And middle is 9, 10, 11 cranial nerves. 9, 10 and 11 cranial nerves. So jugular foramen is clear to all of you? Anterior, middle and posterior compartment. Anterior compartment, what passes is inferior petrosal sinus. The middle compartment is 9, 10, 11 cranial nerves and the posterior compartment is sigmoid sinus. Next, number 10. Number 10 is foramen magnum. Foramen magnum. Foramen magnum. Foramen magnum is divided into two compartments by alar ligament of dens. You know dens, you remember dens, second cervical vertebrae, and axis is the second cervical vertebrae. And what is dens? That process of the second cervical vertebrae is known as the dens or the odontoid process. Odontoid process or the dens. And there are two ligaments attached to this dens. One I told you, apical ligament of dens. And this apical ligament of dens, remember I told you this apical ligament of dens is a remnant of notochord. Notochord, yaad hai notochord? Notochord! You remember notochord? Notochord is formed by the primitive streak. Notochord is formed in the mesoderm. The notochord disappears off except for two remnants of notochord. One I told you, nucleus pulposus of intervertebral disc, and the second one is apical ligament of dens. Apical ligament of dens is a remnant of notochord. And this apical ligament of dens is attached to the odontoid process, okay, of the dens. And the second ligament which is attached to the dens is the alar ligament of dens, okay. And the alar ligament goes laterally. This divides the foramen magnum into an anterior and a posterior compartment. Very good. Anterior and posterior compartment. So what passes to the anterior compartment? Only bones and vessels pass. Only bones and ligaments pass. So this is known as the osteoligamentous. Osteoligamentous compartment. Okay. And the posterior compartment, nerves and vessels pass. It is known as the neurovascular compartment. Neurovascular compartment. Okay. So anterior compartment is known as the osteoligamentous and the posterior compartment is the neurovascular compartment. So osseous is bones and ligaments. Okay. So what passes to this is the tip of the dens. Tip of the dens. Second, apical ligament of dens. Tip of dens, apical ligament of dens. And third one is an egg-shaped ligament. That's the cruciate ligament. Cruciate ligament. Tip of the dens, apical ligament of dens and cruciate ligament. Neurovascular compartment. What passes is the lower part of medulla. Lower part of medulla and meninges. Lower part of medulla and meninges. Second, spinal accessory nerve. Spinal accessory nerve. Third, vertebral artery. The vertebral artery goes down and the branches of vertebral artery, they go up. Anterior and posterior spinal arteries. Anterior and the posterior spinal artery. Tonsils. Tonsils of cerebellum. Tonsils of cerebellum. Lower part of medulla, lower part of medulla and meninges. Lower part of medulla and meninges. Spinal accessory nerve. Lower part of medulla and meninges, spinal accessory nerve, the vertebral artery, the anterior and posterior spinal arteries, and the tonsils of cerebellum. Tonsils of cerebellum. This is clear to all of you? This is clear to all of you? Yes? Right. Understand now what I'm telling you. This is clear now to all of you? Look, this is nice. Just try to understand this now. Look, I'll start. The only two nerves which are going inside the skull, the only two nerves which are entering the cranial cavity, otherwise all the nerves will leave the skull. They will get out through the skull through various foramens. Okay, look, this is so nice. Just understand this. Okay, which are the two nerves which are entering the skull? The first nerve and the second nerve. How does the first nerve enter inside the skull? Tonsils is the last part. Tonsils is the last part of cerebellum. Tonsils of the cerebellum. They project outside. Tonsils of the cerebellum. It's a part of cerebellum. Okay, listen here now. You are following this now. It is easy. I have not still yet come to the difficult topic. Okay, these are all easy topics of head and neck. Difficult is difficult. Okay, we'll see that later. So what I'm telling you is there are only two nerves which are coming inside the skull. The first and the second nerve. How does the first nerve enter the skull? Through the cribriform plate of ethmoid. How does the second nerve enter the skull? Optic nerve. Through the optic canal. Rest all the nerves will get outside the skull. So start. Tell me now. 3, 4, 6. How do they get out? Through the superior orbital fissure. Right? 3, 4, 6 nerves get out through the superior orbital fissure. The fifth nerve has got 3 branches. Ophthalmic, maxillary, mandibular. Ophthalmic gets out through foramen rotundum. The maxillary gets out through foramen ovale. Ophthalmic division gets out through superior orbital fissure. I'm so sorry. The maxillary nerve gets out through foramen rotundum and the mandibular nerve gets out through foramen ovale. Take. 7th and 8th nerve gets into the internal acoustic meatus. 9th, 10th and 11th nerve gets out through the jugular foramen. And the last nerve is the 12th nerve. It gets out through hypoglossal canal. Hypoglossal canal, also known as the anterior condylar canal. Hypoglossal canal. Okay, that I have to tell you. I have not written that. Okay. So the last nerve is left here. Number 11 is anterior condylar canal. Posterior compartment is neurovascular compartment. Neurovascular, nerves and vessels. Neurovascular compartment. What passes is hypoglossal nerve. Posterior compartment, what passes is hypoglossal nerve. If anything is left here, finish this. Seven nerve, yes, but they go outside the skull. No? They get out from the cranium. They get out of the cranium, basically. The meaning is that. Chalo, clear? Clear to all of you? I'll show you the slide once again. Have a look. Understand this. So I'm done with interior of skull. This was the slide here. Clivus, the brainstem lies on that. Clivus, the brainstem lies on the clivus. Okay. Hypoglossal canal is on either sides of foramen magnum. On either sides, number 11. It's on either sides of hypoglossal canal. Yes. Alar ligament of dens. See, alar ligament, you know the tip of the dens? From the tip of the dens, a ligament begins, which goes on either sides. This is the foramen magnum. From the tip of the dens, the alar ligament begins and goes on either sides. And this alar ligament will divide the foramen magnum into two compartments, an anterior and posterior compartment. That's how it is. Okay, so this I complete now. Foramen magnum, what is difficult? Wait, no, we'll see now. We'll see. I'll show you that. Slides. Look at this. Look, one moment. One moment. That's the slide. Look at this slide. God, what is happening? Okay, that's the slide. Have a look now, fast. Look. What is this now? That's the lesser wing of sphenoid. What's this now? That's the pitchous part of temporal bone. Pitchous part. So what is this? What is this? Anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Clear to all of you? Now, what is this now? That's a cribriform plate of ethmoid. What is this now? Optic canal. Optic canal. What is this below the lesser wing of sphenoid? That's the superior orbital fissure. Superior orbital fissure. Okay. Now, what is this? This is the foramen rotentum, foramen ovale, foramen spinosum, and what's that? Foramen lacerum. Okay. This is the pitchous part of temporal bone, and this is the internal acoustic meatus. Internal acoustic meatus. This big foramen that you're looking at, that's the jugular foramen. Jugular foramen. Here, that's the jugular foramen. That's the foramen magnum. This is the foramen magnum. And on either sides here is the hypoglossal canal. On either sides of foramen magnum is the hypoglossal canal. Clear to all of you? Now what is this? What is this area for? This is the area for transverse sinus. The transverse sinus then becomes an S like this. S. What's that? Sigmoid sinus. And the sigmoid sinus will get out through the posterior compartment of the jugular foramen. Clear to all of you? This is the pitchous part. So there's a sinus here, that's the superior petrosal, and a sinus here, that's the inferior petrosal. And the inferior petrosal sinus will get out through anterior compartment of jugular foramen. Clear to all of you? So jugular foramen is clear. Anterior compartment, inferior pectoral sinus, middle compartment, 9, 10, 11 cranial nerves, and the posterior compartment is the sigmoid sinus. The sigmoid sinus now continues as the internal jugular vein. Okay, this is jugular foramen. It's not very clearly seen in this. Okay, clear to all of you? Right. I'll just tell you this infratemporal fossa. If I show you the picture earlier, you'll not understand. So first it is better to understand the theory part, and then you see the picture. Only then you'll understand it. Otherwise, how will you understand the picture? Nervous spinosus, I'll tell you nervous spinosus. Just wait. We have to discuss that. Okay, it is easy. Now you just have to correlate that. It will take time. You'll understand. Now I'll just tell you the infratemporal fossa. Nervous spinosus, I'll tell you. Just wait. What is 11 point? Anterior condylar canalitis or hypoglossal canal. What passes through that is hypoglossal nerve. Okay, clear to all of you? Now understand this now. Infratemporal fossa. I'll show you that. Just wait. Infratemporal fossa. Lateral ramus of the mandible. Ramus of the mandible and medial pterygoid. Very good, very good. 11th nerve has come twice. Very good, very nice. 11th nerve has come twice. You understanding this? This is what I want you to ask and understand. Very nice. 11th nerve has come twice. How? Once it enters the skull, and once it leaves through the from the skull, it enters the skull through foramen magnum, the 11th nerve. This I'll tell you in the brain. The 11th nerve enters the skull through foramen magnum. Which 11 is that? Spinal accessory. Spinal accessory arises from the spinal cord, and the spinal accessory enters the skull through posterior compartment of foramen magnum. Inside the skull, what arises is cranial accessory. So the spinal accessory joins with the cranial accessory, forms a complete accessory nerve, and this accessory nerve comes outside the skull through jugular foramen. Understanding? Yes. Accessory nerve gets outside the skull through jugular foramen. Clear to all of you? Okay, clear? So starting with infratemporal fossa, boundaries laterally is the ramus of mandible and the medial pterygoid. Medially is the pterygopalatine fossa. Medially is the pterygopalatine fossa. You'll understand everything. See, head and neck and brain are correlative. Okay, no? So partly you'll understand in head and neck, and partly you'll understand in the brain. But you'll understand. Just wait. Have patience. Because everything cannot be explained here in this head and neck. This is pterygopalatine fossa. Okay, so medially is the pterygopalatine fossa. Roof is formed by greater wing of sphenoid, root is formed by greater wing of sphenoid. Hypoglossal canal, you have written a hypoglossal canal, also known as anterior condylar canal. Hypoglossal canal is known as anterior condylar canal, and what passes through that is hypoglossal nerve. So roof is formed by greater wing of sphenoid, contains one pterygoid venous plexus, second medial and lateral pterygoids, Third, mandibular nerve. Maxillary artery. Maxillary artery. Okay, mandibular nerve, maxillary artery. Pterygoid venous plexus, the medial and the lateral pterygoids, the mandibular nerve, and the maxillary artery. Clear to all of you? Fine, that's it. Understood? The interior of the skull and the pterygopalatine fossa. You're clear with this? I'll show you the slide once again. Understand the theory part of it. Once the theory is clear, you will be immediately able to understand the slide. You remember this. If you know it, you will see it. What minds don't know, eyes don't see. It's like that. So if you know this is it, you'll be able to see it in the slide. Clear to all of you? Okay. Okay, that's good. Now, starting with mandibular nerve. Mandibular nerve. Okay, understand this. Extremely important is mandibular nerve. Okay, the moment you know mandibular nerve, you know half of the head and neck. Mandibular nerve is a nerve which pharyngeal arch first. So all the muscles which the mandibular nerve is going to supply will be derived from the first pharyngeal arch. Okay, understand this mandibular nerve. It should be on the tip of your tongue. Okay, that's good. Sure. Starting with mandibular nerve. Now what I'm telling you is, you'll understand everything. Wait, don't sit and type things. Spinal accessory, everything I'll tell you. Okay, just be with me. Like, okay, now what I'm telling you, mandibular nerve. Mandibular nerve. Chalo, answer. Mandibular nerve, how does it get outside the skull? It gets out through foramen ovale. And the moment the mandibular nerve gets out through the foramen ovale, where is it? Where is it? Infratemporal fossa. Infratemporal fossa. And what I was telling you is, when a nerve lies in the cranial fossa, it is supposed to supply the meninges of that cranial fossa. You're following? If a nerve is lying in the anterior cranial fossa, it would supply the meninges of anterior cranial fossa. If a nerve is lying in the middle cranial fossa, it would supply the meninges of middle cranial fossa. It's like that. So mandibular nerve is lying in which cranial fossa? Middle cranial fossa. Okay. So it should supply the meninges of the middle cranial fossa. And this it should have done when it is inside the skull. You following this? But we don't know what happens. It is said that somehow the mandibular nerve forgets to supply. Like we forget. The mandibular nerve also forgets. It forgets to supply the dura mater, and it gets outside the skull through the foramen ovale. And the moment it gets outside the skull, where is the mandibular nerve now? In the infratemporal fossa. And now suddenly it remembers it has to supply the meninges. What does it do now? It gives a branch, and this branch will go in the reverse direction of the mandibular nerve, and this will now go through, foramen ovale is already full now with MALE structures, but there's a foramen right behind the foramen ovale. And what's that? Foramen spinosum. The nerve enters the skull through the foramen spinosum. The nerve is therefore known as the nervus spinosus. Am I clear now? Nervus spinosus. Now this nerve goes in the reverse direction of the mandibular nerve. Tell me, anything which goes in the reverse direction is known as what? Reverse direction of the parent nerve. Recurrent. So this is what we call as the recurrent branch of mandibular nerve. Or there's one more name. This nerve goes to supply the meninges. It is therefore known as the meningeal branch of mandibular nerve. I hope this is clear now. Okay, starting with mandibular nerve. A very important thing, mandibular nerve, you should be perfect. Mandibular nerve has a main trunk and two divisions, anterior and posterior. So branches from the trunk. Branches from the trunk. 1. Nervus spinosus. meningeal branch or recurrent branch. Meningeal branch of mandibular nerve. Clear? Meningeal branch or recurrent branch of mandibular nerve. Neither leaves the skull through foramen, enters the skull through enters the skull through foramen spinosum and supplies the meninges of middle cranial fossa. Supplies the meninges of middle cranial fossa. Is this clear to all of you? Nervus spinosus. The second one, the branches from the trunk we are writing, it's nerve to medial pterygoid. Nerve to medial pterygoid supplies the medial pterygoid Nervus spinosus is not a cranial nerve, it's a branch, it's not a main nerve. Supplies the medial pterygoid, and look, it also supplies two more muscles. The nerve to medial pterygoid supplies the medial pterygoid and also supplies two more muscles, one in the ear, which is going to tense the tympanic membrane. What is that? Tensor tympani. And one in the palate, which is going to tense the palate, tensor palatal. So both tensor palatal and tensor tympani muscles would be derived from first pharyngeal arch, and that is how they are supplied by mandibular nerve. Just try to understand like this. So nerve to medial pterygoid supplies the medial pterygoid, tensor palatal and tensor tympani. Tensor palatal and tensor tympani. Anterior division. Anterior division gives three muscular branches, one cutaneous branches. Okay, remember this, just make flowcharts wherever it is always easy to remember if you make flowcharts. So anterior division gives three muscular, one cutaneous branch. Look here, one moment. Tell me, what I'm telling you is this muscular branches are going to supply the muscles of mastication. Now we have got four muscles of mastication. One, temporalis, second, masseter. These two muscles are outside. This is temporalis, this is masseter, and two are in the infratemporal fossa. What is that? The medial and the lateral pterygoids. Okay. So medial pterygoid is already supplied. So one, temporalis. The nerve is known as the deep temporal nerve. Second, masseter. The nerve is known as masseteric nerve. And the third one is nerve to lateral pterygoid. Okay, so three muscular branches supplies the muscles of mastication. One, masseteric nerve. Second, deep temporal nerve. And third is nerve to lateral pterygoid. Nerve to lateral pterygoid, one cutaneous branch. This is known as buccal nerve. Chalo, you tell me, where have we come across buccal nerve? You can answer this. Where have we come across the buccal nerve? Answer this. Where have we come across the buccal nerve? Remembering buccal nerve? You remember the sensory nerves of the face that we were discussing yesterday? This much part of the face is supplied by whom? Ophthalmic. This is maxillary and this is mandibular. Mandibular division, remember the nerves, the branches of mandibular, the nerve which was coming out from here. What is this foramen known as? Mental. The nerve which comes out from here is therefore known as what? Mental nerve. Remember the nerve which supplies the skin here over the buccinator, this nerve which was coming out, that's the buccal nerve. And there was a nerve which supplies the skin over the auricle and the temporal region. What's that? Auriculotemporal nerve. So this will all be branches of mandibular nerve. We are discussing the mandibular nerve now. Will be coming across all these branches. Okay. So buccal nerve. What does the buccal nerve supply? It's a sensory nerve. It's a cutaneous nerve. Remember. Buccal nerve supplies the skin. It's a cutaneous nerve. Supplies the skin over the buccinator. Supplies the skin over buccinator. Supplies the skin over the buccinator. Remember, buccinator is a muscle of facial expression, and buccinator would be supplied by facial nerve. No confusion, huh? Yes, very good. And the last, posterior division. Posterior division, the branches. The first branch is lingual. The first branch is lingual nerve. Lingual. I'll show you all the slides. Just understand this. Lingual nerve. What is the lingual nerve supplying? Lingual nerve. If you can just tell me, lingual nerve supplies the tongue. Fine, fine. Very good. Tongue. How much part of the tongue? How much part of the tongue? We divide the tongue into anterior 2/3, posterior 1/3, and the posterior most part. So the lingual nerve supplies how much part of the tongue? It supplies the anterior 2/3 of the tongue. Anterior 2/3 of the tongue. What sensations? Now sensations are of two types. One is general sensation and the second one is special sensation. General sensations meaning touch, pain, temperature, and special sensations meaning taste. So what is the lingual nerve supply? General sensations to anterior 2/3 of the tongue. Supplies general sensations to anterior 2/3 of the tongue. Okay. Now it is joined by chorda tympani. Chorda tympani is a branch of what? Facial. It is joined by chorda tympani, which supplies special sensations to anterior 2/3. Okay, it is joined by chorda tympani, which supplies special sensations to anterior 2/3 of the tongue. So first nerve is lingual. Second is inferior alveolar. Inferior alveolar nerve. I'll show you all the slides, just wait for some time. Okay, inferior alveolar nerve. Now, inferior alveolar nerve. Have a look at this slide. The inferior alveolar nerve is a branch of posterior division of mandibular nerve. It enters into the mandibular foramen. That's a mandibular foramen. It enters into the mandibular foramen. It supplies the lower jaw and the teeth, and it emerges out as what? What is this nerve now? Mental nerve. This is the mental nerve. You remember mental nerve? So inferior alveolar nerve enters the mandibular foramen, supplies the lower jaw and the teeth, and emerges out as mental nerve. Mental. Okay. Now, before entering the mandibular foramen, have a look at this slide. This is the inferior alveolar nerve. This inferior alveolar nerve would enter into the mandibular foramen, but before it enters the mandibular foramen, it gives a branch here. Look at this branch. Look at this branch. And this branch is going to supply a muscle here. A muscle which separates the mouth from the neck. A muscle which is also known as the oral diaphragm. What's that? Mylohyoid. Mylohyoid. And what is this muscle which lies on the mylohyoid, which has got two bellies? That's the anterior belly of digastric. So what is this nerve known as? That's the nerve to mylohyoid. And this nerve to mylohyoid supplies the mylohyoid and the anterior belly of digastric. That means mylohyoid and the anterior belly of digastric would be derived from first pharyngeal arch. Mylohyoid and anterior belly of digastric would be derived from the first pharyngeal arch. You following this? Okay. So inferior alveolar nerve diagram enters the mandibular foramen, supplies the lower jaw and the teeth. Emerges out as mental nerve. Emerges out as mental nerve. Before entering the mandibular foramen, it gives a branch. Before entering the mandibular foramen, it gives a branch that's nerve to mylohyoid. Nerve to mylohyoid, which supplies mylohyoid and the anterior belly of digastric. Clear to all of you? Which supplies the mylohyoid and the anterior belly of digastric. Okay, clear to all of you? I'll show you the slide, just wait. And the last nerve, the third nerve is auriculotemporal nerve. The last one is auriculotemporal nerve. So there are three branches from the posterior division. One is lingual, one is inferior alveolar, and the third one is auriculotemporal. I'll repeat the diagram. I'll show you the diagram. Just wait, just understand this nerve first. Then you see the slides. It will be clear. Auriculotemporal nerve arises as two roots enclosing the middle meningeal artery. So it arises as two roots. All these things I'll show you. This was in fact an Ames visual slide. Okay. This auriculotemporal nerve arises as two roots, and what is present between the two roots is the middle meningeal artery. Supplies the skin over auricle. Supplies the skin over auricle and the temporal regions. This we know. This you know, supplies the skin over the auricle and the temporal regions. This we know. And the last point, also carries postganglionic parasympathetic fibers from otic ganglion to Parotid gland. Now what is this? I'll explain later. What is postganglionic? What is parasympathetic fibers? From the otic ganglion to the parotid gland. Now what is all this? I'll show you this later. Okay, so that's about the mandibular nerve. This is about the mandibular nerve. Now see the slides and get oriented to all the slides. Okay. Understand all the slides now. I'll start. Now once again, I'll just quickly go through this. Listen here now. Mandibular nerve, tell me, mandibular nerve is a nerve which pharyngeal arch? First, so all the muscles which are supplied by the mandibular nerve would be derived from first pharyngeal arch. Okay. Now which are these muscles which are derived from the first pharyngeal arch? One is the muscles of mastication. Those four muscles of mastication, masseter, the temporalis, the medial and the lateral pterygoids, all are supplied by mandibular nerve. One muscle in the ear, one in the palate, that's tensor tympani, tensor palatal. Two more muscles, one is the mylohyoid and second one is the anterior belly of digastric. So all these muscles would be derived from first pharyngeal arch. First pharyngeal arch. Who's asking me mandibular nerve is a branch of what? Okay. Just don't keep on typing all the such questions. Okay, just concentrate on what I'm telling. Don't ask such silly questions. Clear? Just listen to what I'm telling you. Otherwise, you'll keep on typing and then you'll not listen. And again, you'll keep tell me to repeat. Just listen to what I'm telling. Who's asking me mandibular nerve is a branch of what? The mandibular nerve is over now. You've drawn the interior of skull, you've drawn the trigeminal ganglion, you've drawn the three branches of trigeminal ganglion. Don't ask such questions and don't keep on typing, wasting your time and energy into typing these questions. Instead of that, you listen to me. Okay? So now mandibular nerve has got a main trunk and it has got two divisions, anterior and posterior division. Which are the two branches from the trunk? One is the nervus spinosus, which supplies the meninges of the midcranial fossa. The second one is nerve to medial pterygoid, which supplies the medial pterygoid, the tensor palatal and tensor tympani muscles. Anterior division gives three muscular, one cutaneous branch. Muscular branches to one masseter, second temporalis, and third is lateral pterygoid. And it gives one cutaneous branch, that is known as the buccal nerve, which supplies the skin over the buccinator. Clear? Posterior division gives three branches. One is the lingual nerve, which supplies general sensations to anterior 2/3 of the tongue, and this lingual nerve is joined by chorda tympani, which is a branch of facial, which supplies special sensations to anterior 2/3. The second branch is inferior alveolar nerve. Inferior alveolus is the teeth. Inferior is the lower teeth. This is clear now. The lower jaw and the lower teeth. This is supplied by inferior alveolar nerve. And this inferior alveolar nerve enters the mandibular foramen, supplies the lower jaw and emerges out as mental nerve, which supplies the skin here. And before entering the mandibular foramen, it gives a branch, nerve to mylohyoid, which supplies the mylohyoid and the anterior belly of digastric. And the third branch is auriculotemporal nerve, which supplies the skin over the auricle and the temporal regions, and also carries the postganglionic parasympathetic fibers. Now what is this parasympathetic nervous system? We'll be discussing after the break. Okay, so it carries the postganglionic parasympathetic fibers from a ganglion. What is that ganglion? Otic ganglion to a gland. What is that gland? Parotid gland. Now what is otic ganglion? What is parotid gland? What is parasympathetic nervous system? I'll be telling you after the break. This is a difficult, the most difficult part of anatomy. Okay. Which other question I have not read? Yes, Pratik Gurav. Okay. Clear to all of you. So that's about the mandibular nerve. Don't disturb. Understand? Now, just have a look at this slide. Have a look at this slide now. These are some very important slides. Have a look at them and just try to understand. Look now. And there are plenty of visual slides that you get on this infratemporal fossa and all. Clear? Now have a look. Understand this now. Where are we? Where are we? Where are we? What is this region? Where are we? We are in the infratemporal fossa. I'll show you this now. Now just see the slides, see the slides. Concentrate properly. Do not keep on asking me again and again. Just concentrate on the slides now. Now tell me, where are we? We are in the infratemporal fossa. What have we cut here? The ramus of the mandible. What is this muscle? This is the lateral pterygoid. That's the medial pterygoid. Fine. What is this artery here? This is a maxillary artery. And the mandibular nerve is lying deep to these muscles. Now you can, in the infratemporal fossa, you'll always see two nerves which are going down. Okay, in the infratemporal fossa, you'll always see two nerves which are going down. How do you identify this? Now this is the lingual. In front, the nerve is the lingual nerve. And this nerve, which is entering the mandibular foramen, this is the inferior alveolar nerve. Lingual nerve and inferior alveolar nerve. So this nerve is the lingual nerve and this nerve is the inferior alveolar nerve. Okay, I'll show you some other slides. Just one moment. Lingual, inferior alveolar. Okay, you wanted to see that first slide. Just one minute. Okay, look at this slide once again. This was the slide which you were asking me. Yes. This is the slide. Here, look at this. This is a very important slide. Just have a look here. Tell me now, what is this? This is a section of the skull. What is this now? That's a trigeminal ganglion. Trigeminal ganglion lies in the Meckel's cave, and this ophthalmic, maxillary and mandibular divisions are the branches of trigeminal ganglion. So that's the ophthalmic division. Enters the skull, leaves the skull through superior orbital fissure, enters the orbit, and in this orbit there's a ganglion here. Just have a look. Understand this ganglions, I'll be telling you after the break. Okay, I just want you to see this ganglion. What is this ganglion which lies in the orbit known as the ciliary ganglion? That's the ciliary ganglion. Fine. Now what is this now? This is the maxillary nerve. Leaves the skull through foramen rotentum. Leaves the skull through foramen rotentum. Now enters into this fossa. What's that? Pterygopalatine fossa. And now this nerve goes straight and gets out below the orbit through this foramen here. What's that? Infraorbital foramen. The nerve is now known as what? Infraorbital nerve. That's infraorbital nerve. That means infraorbital nerve is a continuation of maxillary nerve. Am I clear? The maxillary nerve leaves the skull through foramen rotentum, enters the pterygopalatine fossa and gets out as infraorbital nerve. Now inside the infratemporal fossa there's a ganglion which is hanging from the maxillary nerve like this. There's a ganglion which is suspended from the maxillary nerve, and this ganglion lies in the pterygopalatine fossa. This ganglion is therefore known as the pterygopalatine ganglion. Pterygopalatine ganglion. I just want you to see this ganglion. So after the break I'll be discussing all these things. Okay, so that's the pterygopalatine ganglion which is hanging from the maxillary nerve. This is the ciliary ganglion. Clear to all of you? Now there are two more ganglions. Just one moment. Two more ganglions. Look at this slide. Look at this slide. What is this nerve now? That's the mandibular nerve. Mandibular nerve. It gets out through foramen ovale. Foramen ovale. This is a small anterior division, and this is a big posterior division. Okay. From the posterior division, what is this nerve here? This is the lingual nerve. This is the lingual nerve, and hanging from the lingual nerve is a ganglion here, and this ganglion is known as the submandibular ganglion. Submandibular ganglion. Okay, so hanging from the lingual nerve is the submandibular ganglion. Okay, what is this nerve? This is the inferior alveolar nerve. You know this now, inferior alveolar nerve. And what is this branch of inferior alveolar nerve? That's the nerve to mylohyoid. Look, this is the nerve to mylohyoid, which supplies the mylohyoid and the anterior belly of digastric. And look at this nerve. This is the nerve which arises as two roots. You can see these two roots here. And this is the auriculotemporal nerve. So this auriculotemporal nerve arises as two roots. And what is it enclosed between the two roots? What is this artery here? The middle meningeal artery. The middle meningeal artery encloses. Clear? I hope this should be clear to all of you. Right? So clear with all the slides. Understood the mandibular nerve? Mandibular nerve is very important. The moment you know mandibular nerve, you know half of the MCQs of head and neck. Okay. Fine, I'll just tell you one small topic and then we stop for the break. Mandibular foramen is present on the inside the on the inner aspect of the ramus. Inner aspect of the ramus. Huh? This is the outer aspect of ramus. Inner aspect of ramus. Okay, clear to all of you? Now I'll start with one small topic here. I'll start with this dural venous sinuses. We'll just finish the dural venous sinuses. Okay, small topic. So later now it will be easy for you. The most difficult thing would be the autonomic nervous system. Okay, the ganglions and all. I just showed you 4 ganglions. Look, one is ciliary ganglion, one is pterygopalatine ganglion, one is the submandibular ganglion, and there's one more ganglion, otic ganglion. Otic. Now, what are these ganglions? And what is this ganglions to do with the parasympathetic nervous system? We'll see later. I'll finish this topic. Starting with the dural venous sinuses. Understand this now. A very important topic. Chalo, start. Which is the outermost meninges? The outermost meninges, dura mater. The outermost is dura mater. Who's outside the dura mater? The skull, end ostium of the skull. So outside the dura mater is the end ostium of the skull. Yes, buccal is a branch of facial. Buccal branch is a branch of mandibular also. What is the difference? One is sensory, one is motor. Okay, clear? So buccal branch of facial is motor, buccal branch of mandibular nerve is sensory. Okay, clear to all of you? Very good, very good. Now understand this now. Dural venous sinuses. Shall I start? Which is the outermost meninges? The dura mater. Who's outside the dura mater? The skull, the endosteum of the skull. And who's on this side of the dura mater? The arachnoid mater. Now, the dura mater divides into 2 layers. One layer goes close to the end ostium of the skull, and this is what we call as the end ostial layer. End ostial layer. The second layer goes close to the meninges, and this is what we call as the meningeal layer. So the dura mater divides into an endosteal layer and a meningeal layer, encloses a space between them. A space is known as what? Sinus. And this sinus is located within the dura mater. We call this as the dural sinus. And all the sinuses are filled with venous blood. So all the sinuses are therefore known as the dural venous sinuses. Am I clear? But the topic is dural venous sinuses. Okay, because these sinuses are located within the dura mater, and what do these sinuses contain? Venous blood. So dural venous sinus. Okay, fine. Understand this now? Look at this slide. Now what is this fold of dura mater? What is this fold of dura mater? This is the falx cerebri. Falx cerebri. This is the falx cerebri. And this falx cerebri is going to separate the 2 cerebral hemispheres. It separates the 2 cerebral hemispheres. Okay, that's a falx cerebri. And this falx cerebri goes up, and it splits here. And this is attached to the sagittal suture. Sagittal suture, it encloses a sinus here, named the superior sagittal sinus. Superior sagittal sinus here. So this falx cerebri on its superior border will enclose what? The superior sagittal sinus. This entire thing is superior sagittal sinus. Now this superior sagittal sinus, look at this. This is the superior sagittal sinus here. Okay. And this superior sagittal sinus will begin from here. Look, it will start from here. It will come back. It will start from here. It comes back. And now it goes to the right side. What is this known as? The right transverse sinus. The right transverse sinus now becomes an S. And what is this S known as? Sigmoid sinus. And this sigmoid sinus now gets out through the posterior compartment of the jugular foramen, and this is what we call as the internal jugular vein. Following this, internal jugular vein. Look, The superior sagittal sinus starts from here, goes straight back, now becomes the right transverse sinus. It goes to the right side, right transverse sinus, then it becomes an S, that's a sigmoid sinus, and then it becomes the internal jugular vein. Internal jugular vein. Clear? Okay. Now tell me, what is this fold of dura? One moment. Okay, look at this slide now. Tell me now. Okay, I'll start. Have a look. What is this fold of dura mater? Same, it will be on this side. Huh? Same like this on this side. We have cut it on this side like this. Same on this side. Like this. This is a fold of dura mater here. Who's lying on this fold of dura mater? Who's lying on this fold? The occipital lobe of the brain, the occipital lobe of the cerebrum. And who's lying below this? Below this, the cerebellum. Below this lies the cerebellum. And this is acting as a tent for the cerebellum. And this is what we call as the tentorium cerebelli. Tentorium cerebelli. Okay. So this is what we call as the tentorium cerebelli. Okay. So that's the tentorium cerebelli. Who lies below the tentorium cerebelli is the cerebellum, and who's lying on the tentorium cerebelli is the occipital lobe of the cerebrum. Occipital lobe. Okay, have a look here now. Right. What is this fold of dura mater? Once again, what is this fold of dura mater? Falx cerebri. The lower part of the falx cerebri is attached to this. You know, tell me what is this part of the brain that I've drawn? What is this part of the brain? Corpus callosum. So the lower part of the falx cerebri is attached to the corpus callosum. It splits over the corpus callosum. It encloses a sinus above the corpus callosum named the inferior sagittal sinus. Here, that's the inferior sagittal sinus here. Now this inferior sagittal sinus has to come back. It has to come back. So now this inferior sagittal sinus runs in the tentorium cerebelli. It now comes in the tentorium cerebelli. And this is what we call as straight sinus. Just one moment, have a look. The inferior sagittal sinus will begin from here. It will begin from here. It will come back. It will come back like this, like this, like this. That's the inferior sagittal sinus. I can make a three-dimensional view for you. So inferior sagittal sinus will begin from here. It comes back. Now it runs in the tentorium cerebelli. And this is what we call as the straight sinus. Straight sinus. So inferior sagittal sinus, first it becomes what? Straight sinus, and now it goes to the left side, left side. What do you call this as? Left transverse. Then it becomes an S, the left sigmoid, and then it becomes the left internal jugular vein. You following this, all of you? Simple it is. Superior sagittal sinus starts from here, goes back. The superior sagittal sinus directly becomes what? Right transverse, then right sigmoid, and the right internal jugular vein. The inferior sagittal sinus first becomes what? Straight sinus, then goes to the left side, left transverse, the left sigmoid, and the left internal jugular vein. This is tentorium cerebelli. Tentorium cerebelli is a fold of dura mater. Look, this is known as the tentorium cerebelli. It is attached like this. It is attached here, and it is attached to the petrous part of the temporal bone. Here, this is the tentorium cerebelli. I'm just drawing it like this here. On this side, this is the tentorium cerebelli. Understood? And why is this gap left? This gap is left for the brainstem to go. This is the clivus. I was telling you, no, this area is the clivus. Look, this is the clivus. And who's lying on this clivus? Brainstem. And the brainstem has to get out through the foramen magnum, so it gets out here like this. So this gap, this gap is for the brainstem to go. Following now? Understood this? Okay, that's about the dural venous sinuses. Just write this down. So this will complete the dural venous sinuses. Start topic at dural venous sinus. Dural venous sinus. Start with this. Superior sagittal sinus. Superior sagittal sinus becomes right transverse becomes right transverse. Yes, superior generally goes to the right, straight goes to the left. It is normally like this, but still there is some mixing of blood. Some mixing of blood is behind, and this is known as the confluence of sinus. Confluence of sinus. Okay, but remember, generally the blood from the superior sagittal sinus goes to the right transverse sinus, and from the straight sinus goes to the left transverse sinus. Okay, right transverse, right sigmoid, right internal jugular vein. The dura mater divides into two layers. One layer is known as the endosteal layer, it goes close to the skull, and the other layer is known as the meningeal layer, which goes close to the arachnoid matter. And between these two layers, it encloses a space named sinus. So these spaces are within the dura mater, sinuses of the dura mater. And what is this spaces contain? Venous blood. So dural venous sinus. Understood now? Yes? Okay, that's great. Now starting with inferior sagittal sinus. Inferior sagittal sinus. First becomes straight sinus. Straight sinus. Straight sinus. Then becomes left transverse. Left sigmoid. Left internal jugular vein. Clear to all of you? Okay, so that's about the okay. Now just 5 more minutes, huh? 5 more minutes. Now look here, look here. Any structure which is going towards the orbit, if any structure from the skull, if it has to go to the orbit, which is the way to go into the orbit? The superior orbital fissure. I told you this. And look, when any structure is going towards the orbit, on the way comes this. Look at this. Who's this here? This is the cavernous sinus. Cavernous sinus. That means what I want you to understand is any structure which is going towards the orbit. Yo, that's the cavernous sinus on both the sides. No, here is the cavernous sinus. So any structure, if it has to go to the orbit, it has to go to the superior orbital fissure. This thing is clear. And when any structure is going towards the superior orbital fissure, on the way comes the cavernous sinus. On the way comes the cavernous sinus. In other words, if any structure has to go to the orbit, as a rule, it will be related to cavernous sinus. Simple. So which are the structures which are going towards the orbit? The third nerve, the fourth nerve, the sixth, there's some problem. I'll tell you after some time. And the ophthalmic division of trigeminal nerve. And these are the structures which are going towards the orbit, and all the structures would be related to the cavernous sinus. Now, which wall of cavernous sinus would they be related to? Lateral wall. Okay, lateral wall. And this is how you get the relations of cavernous sinus. Okay. And now you tell me, what is this big foramen here? What is this big foramen here? In the flow, look, this foramen, what is this foramen here? Foramen lacerum. But you know what? We are not able to see the foramen lacerum. We are not able to see the foramen lacerum. Why? Because there's someone who's covering the foramen lacerum. The cavernous sinus is lying on the foramen lacerum. The cavernous sinus is put on the foramen lacerum. So now you tell me, if the cavernous sinus lies on the foramen lacerum, where is the foramen lacerum with respect to the cavernous sinus? Floor. If you take the cavernous sinus and you put it on the foramen lacerum, automatically foramen lacerum lies on the floor of the cavernous sinus. Following this, and there's a big artery entering the skull through the foramen lacerum. Who's that? Internal carotid artery. And look, this is so nice. The moment the internal carotid artery enters the skull through the foramen lacerum, it's right in the floor of the cavernous sinus. That completes the relations of the cavernous sinus. You're following this? That's how the relations of the cavernous sinus are. It's very easy, you just have to understand the concept. So that's how the relations of the cavernous sinus are. Okay? So understand this cavernous sinus. The relations. Okay, I'll just make the cavernous sinus for you. This is the cavernous sinus. Okay, very good. So that's a cavernous sinus. These are made as cavernous sinus. So who's on the medial side of the cavernous sinus? Just one moment. This is not. Okay, here we are. That's the cavernous sinus. Now, who's on the medial side of the cavernous sinus? This is a gland here. What is this gland here? That's a pituitary gland. And there's an air sinus here. What is this air sinus? The sphenoidal air sinus. Sphenoidal air sinus. And who's related in the lateral wall of the cavernous sinus? Lateral wall. The third nerve, the fourth nerve, the ophthalmic nerve, third nerve, fourth nerve, ophthalmic division, ophthalmic nerve, and the third nerve, the fourth nerve, the ophthalmic nerve. And you know who was supposed to come here? The sixth nerve was supposed to come here, but someone else comes here. Someone who's going towards the foramen rotundum. Who's that? Who's that? Who's going towards the foramen rotundum? The maxillary nerve. The maxillary nerve comes here, and because the maxillary nerve comes here, it pushes this down. So what is this nerve? The sixth nerve. And that's how the sixth nerve comes to lie in the floor of the cavernous sinus. Okay, the sixth nerve lies in the floor of the cavernous sinus, and there's a big artery here. That's the internal carotid artery. Internal carotid artery. Okay, so that's it. And there's something here. There's something here about, what's this? Optic chiasma. This is the optic chiasma. Okay, so this becomes the relations of the cavernous sinus. A very, very important MCQ. What is this nerve? Third nerve. This is the fourth nerve. This is the ophthalmic division, and this is the maxillary division. And that's the sixth nerve. This is the optic chiasma. That's the pituitary gland. And this is the sphenoidal air sinus. Sphenoidal air sinus. Okay, clear to all of you? So that's it. So this becomes the relations of the cavernous sinus. In the lateral wall, the third nerve, the fourth nerve, the ophthalmic and the maxillary nerve. In the floor, the sixth nerve and the internal carotid artery. Medially is the pituitary gland and the sphenoidal air sinus. In the roof is the optic chiasma. Okay, just 2 more minutes. Cavernous sinus is like a reservoir of blood. Okay, it's like a storehouse of blood, reservoir of blood. So there are veins which are coming towards the cavernous sinus, they bring blood towards the cavernous sinus. What do we call such veins as? We call this as tributaries of cavernous sinus, tributaries. And there are veins which will take blood away from the cavernous sinus. What do you call them as? We call them as draining channels, okay. So we have tributaries of cavernous sinus, we have got draining channels. Together we call this as communications of cavernous sinus. So communications of cavernous sinus would include tributaries and draining channels. Okay, clear? I'll just finish this. 2 minutes. Tributaries of cavernous sinus. Tributaries of cavernous sinus. One is from the orbit, one is from the meninges, and one is from the brain. Orbit, meninges and brain. From the orbit, which are the tributaries? Which are the veins which bring blood towards the cavernous sinus? Superior ophthalmic vein. superior ophthalmic vein. You remember dangerous area of face, facial vein, angular vein, superior ophthalmic vein and cavernous sinus. I told you superior ophthalmic vein therefore becomes a tributary of cavernous sinus. Second, inferior ophthalmic vein. Inferior ophthalmic vein, and the third one is central vein of retina. Central vein of retina. So superior ophthalmic, inferior ophthalmic, central vein of retina. Foramen lacerum is in the floor. So internal carotid artery means foramen lacerum. Meninges, which is the vein which brings blood from the meninges? That's the sphenoparietal sinus. Sphenoparietal sinus. Okay, some books mention internal carotid artery lies in the floor. Some books mention it passes through the cavernous sinus, but it is separated from the blood of the cavernous sinus. Okay, anything you can take. Sphenoparietal sinus. Sphenoparietal sinus. And from the brain is the superficial middle cerebral vein. Superficial middle cerebral vein and inferior cerebral vein. Superficial middle cerebral and inferior cerebral vein. Inferior cerebral vein. Okay, so that's superficial middle cerebral and inferior cerebral vein. Okay, clear? So this becomes a tributary of cavernous sinus from the orbit, from the meninges and from the brain. Clear to all of you? Okay. And the last one is the draining channel. So all these things we'll be seeing later from the brain, the veins of the brain and all. You just remember this, what are the tributaries? And the last one is draining channels. Draining channels. Draining channels. Okay. Draining channels of cavernous sinus. Just have a look. What is this sinus? This sinus. Just 2 minutes over. This is the superior petrosal sinus. And this superior petrosal sinus is going to connect what to what? This superior petrosal sinus is going to connect the cavernous sinus to, what is this sinus? Transverse sinus. So the superior petrosal sinus drains the cavernous sinus to transverse sinus. What is this sinus? This is the inferior petrosal sinus. It connects the cavernous sinus to internal jugular vein. In other words, the inferior petrosal sinus drains the cavernous sinus to internal jugular vein. You understanding? Tributaries means the one which joins to the cavernous sinus, yes. And draining channel means they will take blood from the cavernous sinus. Okay. You just write this down, then I'll explain to you. Okay, write on. Superior petrosal sinus. There's no diagram for that. This tributaries brings blood towards the cavernous sinus. Tributaries meaning what? They will bring blood to the cavernous sinus. Understanding? Tributaries will bring blood to the cavernous sinus, and draining channels will take blood from the cavernous sinus, away from the cavernous sinus. So superior petrosal sinus, you clear now, connects the cavernous sinus to transverse sinus. I'll show you the slide. Transverse sinus. Second, inferior petrosal sinus. Inferior petrosal sinus means it will take blood, will connect the cavernous sinus to internal jugular vein. Connect the cavernous sinus to internal jugular vein. How's this? Look, this is the jugular foramen. This is the jugular foramen. What is this vein? What is this? Inferior petrosal sinus. What is this now? Sigmoid sinus. And what is this now? Internal jugular vein. Clear now? Emissary vein is also tributary, fine. Sigmoid sinus continues as internal jugular vein. Okay, you are understanding this? So that's how the inferior petrosal sinus connects the cavernous sinus to internal jugular vein. Internal jugular vein is a continuation of sigmoid sinus. Yes. Your first answer would be internal jugular vein. Inferior petrosal sinus gets outside the skull. You're clear now? Inferior petrosal sinus gets outside the skull. The sigmoid sinus gets outside the skull. So the first tributary of internal jugular vein is going to be the inferior petrosal sinus. First tributary of internal jugular vein is the inferior petrosal sinus. The two cavernous sinus are connected by anterior and posterior intercavernous sinus. Connected to emissary vein. Okay, so this becomes the clear to all of you now. So this becomes the tributaries of and the draining channels. Okay, I'll just show you the slide. It will be clear to you. So the thing is that this starts from okay, look here. Understand this slide. Sorry, just one moment. This now. Okay, fine. Just 2 minutes. Pterygoid venous plexus. Pterygoid venous plexus. Yes. Pterygoid venous plexus. Have a look here. Yep. Just 2 minutes. Listen here. That's the cavernous sinus. And you remember this vein coming from the orbit here? What is this vein coming from the orbit here? That's the superior ophthalmic vein. The superior ophthalmic vein brings blood to the cavernous sinus. It's a tributary of cavernous sinus. Now this cavernous sinus is connected to the transverse sinus by, what is this sinus? This one. This is the superior petrosal sinus. So the superior petrosal sinus takes the blood from cavernous sinus to transverse sinus. Okay. Now the cavernous sinus, here he is not drawn that. The cavernous sinus will be connected to the internal jugular vein through, what is that? Inferior petrosal sinus. Outside the skull, outside the skull. The two cavernous sinus will be connected to each other by, one is in front, one is behind. What is this? This is the anterior and this is the posterior intercavernous sinus. Anterior and posterior intercavernous sinus. And the last one, connected to the pterygoid venous plexus. You remember pterygoid venous plexus? Through pterygoid venous plexus, you remember here, and blood from the pterygoid venous plexus goes up to the cavernous sinus. It can also come down to the pterygoid venous plexus. These are all valveless. Okay, so connected to the pterygoid venous plexus through emissary vein. So this becomes the draining channels. There are a lot of controversies on this, tributaries and draining channels. Just remember what I've told you. Just remember this. tributaries, draining channels. That's it about cavernous sinus. Clear? Topic is cavernous sinus. This topic is cavernous sinus or the dural venous sinuses. So dural venous sinuses, I've told you which are the dural venous sinuses and the relations of cavernous sinus, the draining channels and the tributaries of cavernous sinus. Okay, sphenoparietal sinus is a small sinus. It brings blood from the meninges to the cavernous sinus. It's not seen in the slide. It brings blood from the meninges to the cavernous sinus. So tributaries are from the orbit, from the meninges, from the brain. Okay, fine, you take a break now. Just one moment, listen. After the break, I'm starting with parasympathetic nervous system. It is extremely difficult, the most difficult thing. So be fresh and come. So I've finished all the topics beforehand. So parasympathetic nervous system and one or two more topics would be left that I'll finish after the break. Clear? Fine. Take a break then. 15 minutes. It's 11:40. 55 I'll start. 55. Sphenoparietal sinus brings blood from the meninges. It brings blood from the meninges. It's along the lesser wing of sphenoid. Sphenoparietal sinus is along the lesser wing of sphenoid. Okay. $15 minutes break. 15 minutes. 15-20 minutes you take. 12 o'clock. Okay, we'll start. Now understand this autonomic nervous system. Autonomic nervous system. Sympathetic and parasympathetic nervous system. We'll start like this. You tell me parasympathetic nervous system. What is the outflow? Outflow. Parasympathetic nervous system. Outflow is craniosacral. 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 So, where does the cranial part begin from? And where does the sacral part? Just understand this. This is a very difficult topic. It would be taking some time to understand this. Just wait now. Listen here. Parasympathetic nervous system is craniosacral. The sacral outflow begins from S2, 3, 4 segments of the spinal cord. S2, S3, S4 segments of the spinal cord. The cranial outflow begins where? In the brainstem. The cranial outflow begins in the brainstem. Who carries the sacral outflow? The sacral spinal nerves. Sacral spinal nerves. S2, 3, 4 sacral spinal nerves. Who carries the cranial outflow of the parasympathetic nervous system? The cranial nerves. Now which cranial nerves? 3, 7, 9 and 10 cranial nerves. 3, 7, 9 and 10 cranial nerves carry the cranial outflow of the parasympathetic nervous system. Now any autonomic nervous system, if you see, it has got a preganglionic fiber, it has got a ganglion and it has got a postganglionic fiber. Preganglionic fiber, ganglions and postganglionic fiber. So now we are discussing about parasympathetic nervous system. Okay, we will concentrate on the cranial outflow. Okay, I'll start writing this. Just have a look. Starting with parasympathetic nervous system. Just write this down with me. Parasympathetic nervous system. Slowly we go into the topics. These are different topics which you have to bring together to understand. So it's of two parts, a cranial part and a sacral part. Cranial part, sacral part. Now where does the sacral part begin from? S2, 3 and 4 segments of the spinal cord. S2, 3, 4 segments of spinal cord. Okay, that's the sacral outflow. What is the sacral outflow of the parasympathetic nervous system supplies? The hindgut. All these things I'll tell you in the abdomen. Hindgut and the pelvic organs. Supplies the hindgut and the pelvic organs. Okay, so the sacral part. If you can just tell me, which is the longest cranial nerve? The longest cranial nerve, vagus. Fine. Where does the vagus begin from and all that I'll tell you in the brain. The nucleus of the vagus, the fibers where they're attached to the vagus, that I'll tell you in the brain. But just try to understand this. Vagus. How does the vagus get outside the skull? Now where it begins from the brain, which nucleus, that we'll see later in the brain. Okay, I'm just proceeding forwards. How does the vagus get outside the skull? How does it get outside the skull? Through the jugular foramen. This you know. It gets out through the jugular foramen. It's right outside the skull. It's right in the carotid sheath. The vagus is directly lying in the carotid sheath, along with internal carotid artery, internal jugular vein, and the 9th, the 11th, and the 12th cranial nerves. They are lying in the carotid sheath at the base of the skull. The vagus straight away goes down through the carotid sheath. Through the carotid sheath, it goes down, enters the thorax. Okay, let's try to understand this. It enters the thorax. Remembering thorax, which mediastinum have you written the vagus and phrenic nerve? In the superior mediastinum, middle part. Remembering the arch of aorta, the SVC, the vagus and the phrenic nerve. So the vagus now enters the superior mediastinum. The vagus enters the inferior mediastinum, goes behind the hilum of the lung. Okay, it goes behind the hilum of the lung. The vagus enters the abdomen through the esophageal opening of the diaphragm. Through the esophageal opening, it enters the abdomen. The vagus is the longest cranial nerve. It supplies the heart, it supplies the lungs in the thorax. It enters the abdomen, it supplies the foregut, and it supplies the midgut. The midgut is the end of vagal supply. So that's the end of parasympathetic supply of vagus. That's the midgut. So what is left now? The hindgut and the pelvic organs. And who's going to supply this? S2, 3, 4. This is it. S2, 3, 4. You're following this? So all these things now slowly you'll understand. Let me finish the brain and all. Just be with me. Okay. Now we are concentrating on the cranial outflow of the parasympathetic nervous system. Okay, we concentrate on the sacral outflow, I'll tell you in the abdomen. We are concentrating on the cranial outflow. Where does it begin in? It begins in the brainstem. It begins in the brainstem. In the brain or the brainstem. It begins in the brainstem. Carried by which cranial nerves? 3, 7, 9 and 10 cranial nerves. It is carried by 3, 7, 9 and 10 cranial nerves. And what does it supply? What does this nerve supply? This nerve supplies the glands. This nerve supplies the glands. All the glands in the body. All the glands. Okay. So this nerve supplies the glands. So understand this. The cranial outflow of the parasympathetic nervous system. Where does it begin? In the brain, or say the brainstem. Who carries this cranial outflow? The 3, 7, 9 and 10 cranial nerves. Okay, and what do they supply? The glands. One thing you understand, which fibers will arise in the brainstem? The preganglionic fibers. Okay, the preganglionic fibers of the cranial outflow of the parasympathetic nervous system arises in brainstem. Who carries this preganglionic fibers? The cranial nerves. The 3, 7, 9 and 10 cranial nerves are going to carry the preganglionic fibers. Now this preganglionic fibers would be coming to a ganglion. Now which are the ganglions of the parasympathetic nervous system? Cranial outflow. I just showed you 4 ganglions before the break. I just told you the 4 ganglions. 1, pterygopalatine, ciliary, submandibular and otic. These are the 4 ganglions of parasympathetic nervous system. You understanding? That means this nerves would begin from the brainstem. They would be coming to the ganglions. What are these fibers? Preganglionic fibers. The fibers will relay in the ganglions. And what will begin from this ganglions? The postganglionic fibers. And what would the postganglionic fibers supply? The glands. You following this? You got an idea now? So this is going to supply the glands. In other words, what is the cranial outflow of the parasympathetic nervous system going to supply? The glands. Following this? And any autonomic nervous system will have a preganglionic and postganglionic fiber. Fine, no? Now just understand the statement. All the glands in the head and neck. All the glands in the head and neck Head and neck, huh? We're not talking about the body. I'm telling you all the glands in the head and neck is supplied by facial nerve. Facial nerve. I'm not telling you all the glands in the body. Had my question be all the glands in the body are supplied by, your answer would be the parasympathetic nervous system, cranial outflow. I'm very specific now. I'm telling you all the glands only in the head and neck. Who supplies this? Facial nerve. Just say, don't write. Except parotid. The parotid is supplied by glossopharyngeal nerve. Who supplies the glands of GIT? The vagus. You following? You understanding this? Look once again. Don't get diverted and do not type anything. Just put your 100% into this topic. You'll understand it. Otherwise, it is difficult. Again, I'm telling you. Look, what are we discussing? Parasympathetic nervous system. Which outflow? Cranial outflow. Where does this cranial outflow begin? In brainstem. Who carries this cranial outflow? 3, 7, 9, 10 cranial nerves. What fibers are these? Preganglionic fibers. The preganglionic fibers would be coming to the ganglion, and the postganglionic fibers would be supplying the glands. That's the overall concept of the system. Now, which are the nerves? 3, 7, 9 and 10. And what do they supply? Glands. Now, we are very specific. What glands does the glossopharyngeal nerve supply? The glands, the parotid. What glands does the facial nerve supply? The glands of GIT. The glands of head and neck. What glands does the facial nerve supply? The glands of head and neck. Now, what glands in the head and neck are we talking about? Lacrimal, nasal, palatine, pharyngeal, submandibular, sublingual. All these glands in the head and neck would be supplied by facial nerve. What glands is the glossopharyngeal nerve going to supply? Parotid. What gland is the vagus going to supply? The glands of GIT. But there's only one exception. Third nerve. Just remember, there's only one exception. Third nerve. Third nerve does not supply any glands. But third nerve supplies two muscles which are parasympathetic. Who's that? The sphincter pupillae and ciliaris muscle. That's the only exception. Just remember that. Third nerve is the only exception. Third nerve does not supply any glands. It supplies two muscles which are parasympathetic. Who's that? Sphincter pupillae and ciliaris muscle. Okay, you'll understand it. It takes time to understand, but I'll see to it that you all understand. Be with me. All the glands in the head and neck are supplied by facial nerve except parotid, supplied by glossopharyngeal nerve. Glossopharyngeal nerve. Vagus supplies the glands of GIT. The third nerve supplies sphincter pupillae and ciliaris muscle. Sphincter pupillae and ciliaris muscle. Okay, so that's the only exception. Clear to all of you? The third nerve supplies the sphincter pupillae and ciliaris muscle. Sacral fibers are preganglionic. Sacral fibers are again preganglionic fibers. Okay, you're clear? Now understand this now. Now we go into details of the topic. Okay, understand. Look how nice it is. Starting with the glossopharyngeal nerve. Tell me now. Glossopharyngeal nerve begins where? Brainstem. What fibers are this? Preganglionic fibers. Now glossopharyngeal nerve will be coming to a ganglion. I have to tell you this ganglion. The fibers will relay in this ganglion. And what will begin from this ganglion? The postganglionic fibers. And what will they supply? The parotid gland. Okay. So that's the nerve supply of parotid gland. Following? Facial nerves. Tell me, facial nerve. Facial nerve begins where? Brainstem. What are these fibers? The preganglionic fibers. Now, facial nerve has got two ganglions. I have to tell you that. The fibers will relay in the ganglions, and what will begin from here? The postganglionic fibers. And what are they going to supply? All the glands of head and neck except parotid. Following this? Third nerve begins where? Brainstem. What are these fibers? Preganglionic. The third nerve will relay in a ganglion. I'm telling you, ciliary ganglion. And the postganglionic fibers would now supply what? The sphincter pupillae and ciliaris muscle. Following? Last, vagus. Begins in the brainstem. The preganglionic fibers arise. There is no ganglion for the vagus and the head and neck. The preganglionic fibers released in the Meissner's and the Auerbach's plexus. That's in the wall of GIT, Meissner's and Auerbach's plexus. And the postganglionic fibers would now supply the glands of GIT. Okay, following this, so that's the overall picture. Now we go into details of these topics. The overall structure is clear to all of you. Okay, now we go into details of this. Now look. Understand this ganglion now. Once the ganglion is clear, everything will be clear to you. Okay, I'll start. Now, this is how a ganglion looks. You know the nerve, you know what the gland it supplies. Now you just have to understand the ganglion here. You'll understand, just wait, just be with me. Don't ask me questions now, just wait. Now, this is how a ganglion looks. Okay, this is how a ganglion looks. And tell me now, how will this ganglion lie? This ganglion cannot just lie there. It cannot just lie like that. It has to be suspended by something, and this ganglion is suspended by a nerve here. I've shown you this. The ganglions are hanging from a nerve, and this is what we call as the structural relation. Structural relation or topographical relation. This is what the books mention, structural relation. That means, what does structural relation mean? The ganglions are just hanging from the nerve, nothing else. They're just hanging from the nerve. And look, this is so nice. There's another nerve. There's another nerve which will come here, which will enter the ganglion and give these fibers. Now you know what is this fiber. This is the preganglionic fiber. Okay, this is the postganglionic fiber. And now you tell me, what is this pre and postganglionic fibers going to supply? The glands. They supply the glands. And if you can just tell me now, who's this going to be? Who's this going to be? This will be 3, 7, 9 or 10 cranial nerves. And where do they begin from? Brainstem. You getting an idea? So this cranial nerves begin from the brainstem. The preganglionic fibers come, they relay in the ganglions, and the postganglionic fibers would supply the glands. If this is it, we call this as a functional relation. Functional. Okay, you're understanding what is structural and what is functional. Be very clear with your concepts. What is structural and functional relation? Understand once again. You just draw this and I'll explain this. Just draw this. So each ganglion is related to two nerves. Okay, one, it is just hanging from the nerve, and this is structural relation. And there's another nerve which is coming, which will relay in the ganglion and will send postganglionic fibers to supply the glands, and this is what we call as the functional relation. And this is going to be a cranial nerve. Remember, cranial nerve. Okay, now understand this table. Or we'll make it like this. There are 4 ganglions that you have. Pterygopalatine, ciliary, otic, and submandibular. We've got 4 ganglions: pterygopalatine, ciliary, otic, submandibular. Each ganglion is related to 2 nerves. One is structural, one is functional. Okay, tell me now. Pterygopalatine ganglion is hanging from which nerve? I've told you this. Pterygopalatine ganglion is hanging from the maxillary nerve. Maxillary, I've showed you this. Where? In the pterygopalatine fossa. I've shown you this. Submandibular ganglion is hanging from lingual nerve. Where is this? In the infratemporal fossa. Otic ganglion is hanging from mandibular nerve. And the ciliary ganglion is related to nasociliary nerve. Look, this is so nice. If you can just tell me, there's something common in all this. There's something common in all this. And all these are branches of what? Trigeminal nerve. All these are branches of trigeminal nerve. That means all the ganglions are structurally related to trigeminal nerve. Maxillary is a direct branch. Lingual is a branch of mandibular. Mandibular is a direct branch. Nasociliary is a branch of ophthalmic. That means all the ganglions are structurally related to trigeminal nerve. Okay? Trigeminal nerve. I'll be showing you the slide later. Understand the functional relation. Functional relation would be, this is 7, 3, 9, 7. 7, 3, 9, 7. Just write this down. PPG is pterygopalatine. Just write the full name. PPG is pterygopalatine ganglia. Pterygopalatine. Okay. PPG is pterygopalatine. Then is ciliary, then is otic, and then is submandibular. Structural relation, maxillary, nasociliary, mandibular, lingual. Functional relation, 7, 3, 9, 7. 7, 3, 9, 7. Below structural is functional. One is structural, one is functional. This is structural, this is functional. Okay, now you know everything. You know the nerves, you know the ganglions, you know the glands. Now I tell you everything. Okay, just try to understand. You should be able to understand it now. Fine? All of you are ready? Concentrate now. Okay, you should enjoy this. Okay, I'll start. Look, here we start. Starting with the glossopharyngeal nerve. Understand it like this. We start with the glossopharyngeal nerve. Where does the glossopharyngeal nerve begin in? Where does the glossopharyngeal nerve begin? Brainstem, brainstem, brainstem. Now, which nucleus of glossopharyngeal nerve? Which part of the brainstem? All these things you are supposed to know, and all these things slowly I'll tell you. But for now, this much is enough for me. Where does the glossopharyngeal nerve begin? Brainstem. What are these fibers? Preganglionic. Now, this preganglionic fibers would be coming to a ganglion. Tell me now, which is the ganglion functionally related to the glossopharyngeal nerve? Otic ganglion. The fibers will relay here, and the postganglionic fibers will now go to supply the parotid gland. Parotid gland, you're following? This is what we call as a functional relation. Just understand this. Now we go into these details. And this, the otic ganglion, would be hanging from which nerve? Mandibular nerve. That is its structural relation. You're understanding what is structural, what is functional? Now look. Facial nerve begins where? Brainstem. What are these fibers? Preganglionic fibers. Now, facial nerve has got two ganglions. One is the pterygopalatine, one is ciliary ganglion. One is pterygopalatine and one is submandibular. I'm so sorry, submandibular ganglion. The fibers will relay here, and the postganglionic fibers will supply all the glands except parotid. You following this? So this is what we call as functional relation. And this pterygopalatine ganglion would be hanging from which nerve? Maxillary. That is its structural relation. And submandibular ganglion is hanging from lingual nerve. You following this? Yes, Bolo, you are understanding this now? At least some things you are able to follow now. Then we enter into the pathway, you'll understand it better. Okay. Okay, at least some things you are able to follow. So what is a ganglion, what is a nerve, and all these things? Okay, now we're starting with nerve supply of parotid gland. Nerve supply of parotid gland. You'll understand everything now. Now you'll understand everything. Just try to see to it that you understand now. Nerve supply of parotid. Chalo, answer now. Just one more thing. Tell me. No, you'll understand, just wait. Tell me, who supplies the parotid? Chalo. Who supplies the parotid? Cranial nerve. Which cranial nerve supplies the parotid? Answer. Glossopharyngeal nerve, glossopharyngeal nerve. The glossopharyngeal nerve supplies the parotid. Which is the ganglion functionally related to the glossopharyngeal nerve? See the table that you have written. Which is the ganglion functionally related to the glossopharyngeal nerve? Otic ganglion, otic. And what gland does the glossopharyngeal nerve supply? Parotid gland, parotid. Okay, so that's how it is. We enter into this pathway. Just understand this now. Now tell me, glossopharyngeal nerve is a nerve which pharyngeal arch? Understand this, this is very important. Glossopharyngeal nerve is a nerve third pharyngeal arch, third. Nerve the first arch, mandibular. Second arch, facial. Third arch, glossopharyngeal. So glossopharyngeal nerve is a nerve third pharyngeal arch. There's only one muscle in the third arch. Which is the muscle in the third arch? Stylopharyngeus. Stylopharyngeus. So fine. So glossopharyngeal nerve will supply what? Stylopharyngeus. Because it is derived from the third pharyngeal arch. That's fine. Glossopharyngeal nerve supplies the parotid gland. This is what I just told you. Glossopharyngeal nerve will also supply the tongue. Glossopharyngeal nerve supplies many different things. So that means there is not one nucleus of glossopharyngeal nerve. There are many different nuclei of glossopharyngeal nerve. Like this nucleus will supply the tongue, this nucleus will supply the parotid, the third nucleus will supply the stylopharyngeus. And all this nucleus you are supposed to know. Remember, all this nucleus you are supposed to know. That I'll tell you in the brain slowly. Following? That means glossopharyngeal nerve will have a specific nucleus only for stylopharyngeus. Glossopharyngeal nerve will have a specific nucleus only for parotid gland. Glossopharyngeal nerve will have a specific nucleus to supply the tongue. All this nucleus you are supposed to know. Okay, that I'll tell you in the brain. So now you tell me, what is the name of the nucleus of the glossopharyngeal nerve in the parotid, in the brain, which is going to supply the parotid? What is the name of the nucleus of the glossopharyngeal nerve in the brain which is going to supply the parotid? The name of the nucleus is inferior salivatory nucleus. Inferior salivatory nucleus. That means next time, the moment we come to this inferior salivatory nucleus, you should be able to remember that this inferior salivatory nucleus is a nucleus of glossopharyngeal nerve meant to supply the parotid gland. You're following this? Meant to supply the parotid gland. Okay. So starting with nerve supply of parotid gland. You'll understand. Just wait. Let me finish this. You'll understand everything. Nerve supply of the parotid. Starting with this, understand right down. Inferior salivatory nucleus. Inferior salivatory nucleus. That's the nucleus of glossopharyngeal nerve. It's tympanic branch. Tympanic branch of glossopharyngeal nerve. And this tympanic branch of glossopharyngeal nerve is known as Jacobson's nerve. Jacobson's nerve. This tympanic branch will join with the sympathetic plexus. Now you will ask me, we are discussing parasympathetic nervous system, and where does the sympathetic come from? Now these sympathetics are just going to supply the blood vessels. Remember, they will just supply the blood vessels. You'll understand, just be with me. So inferior salivatory nucleus is the nucleus of glossopharyngeal nerve. From the inferior salivatory nucleus you get the tympanic branch. This tympanic branch joins with the sympathetic plexus and forms the tympanic plexus. And you know where is this tympanic plexus located? On the promontory of middle ear. Promontory of middle ear. You know the medial wall of middle ear? That's promontory. That on the promontory lies the tympanic plexus. From this tympanic plexus we get a nerve. What is this nerve? Lesser petrosal nerve. Lesser petrosal nerve. Lesser petrosal nerve, we know. Lesser petrosal nerve comes out through the foramen ovale. And look now, who's come? Our ganglion has come. Look, our ganglion has come. That's the otic ganglion. Otic ganglion. And the fibers would go and supply now the parotid gland. Fibers would now supply the parotid gland. You understand, that's the nerve supply of parotid. This is the nerve supply of parotid. Okay. That's a nerve supply parotid. Just write down. Now you'll understand this. Look, try to understand this now. Okay, I'll start. Tell me, where are we? Where is this? In the brainstem. That's in the brainstem. This is in the brainstem. From the brainstem to this ganglion, Look, this is the ganglion. From the brainstem to this ganglion, what are these fibers? These are the preganglionic fibers. And what are these fibers? These are the postganglionic fibers. You understanding? So where do we begin from? Brainstem. This is the ganglion. So these fibers are the preganglionic fibers, and these fibers are the postganglionic fibers. You tell me now, what is this relation? What is this relation? This is functional relation. This is what I'm telling you. Functional relation. Functional relation. This topic is difficult, I'm telling you. It is difficult. You have to concentrate a lot to understand this. Structural relation are branches of trigeminal nerve. Structural relations are branches of trigeminal nerve. You'll understand. Just wait. You'll understand. Just wait. Be with me. So look now. Look here once again. Look here. Don't get confused. I told you. See, the topics which are difficult at the beginning itself, I tell you. So just try to concentrate. You'll understand it. Just wait. Where is this located? Once again, where is this located? This is located in the brainstem. Okay. Where is this located? In the brainstem. This is in the brainstem. From the brainstem to this ganglion, what are these? Preganglionic fibers. And what are these? Postganglionic fibers. So what is this relation? Functional. This is what we call as functional relation. Look here. I'll make it simple for you. Look. This is so nice. You should understand this. Look, this was a general representation. Which I had made. What nerve are we now talking about? Glossopharyngeal. Now we're talking specifically about glossopharyngeal nerve. What ganglion are we specifically talking about now? Otic ganglion. We are specifically talking about otic ganglion. And what gland are we talking about now? What gland is that? Parotid. This is parotid gland. You're following? So now you tell me, what are these fibers? Preganglionic. And what are these fibers? Postganglionic. What is this relation? Functional. Okay. I'll tell you. That no lesser petrosal nerve first enters inside from the ear, it enters inside the skull. And then it gets outside the skull. From the ear, it enters inside the skull. Your person is right. The lesser petrosal nerve is in the ear, no? So from the ear it gets out. There's a tympanic canalicularis. From there it enters into the middle cranial fossa. And from there it gets out through foramen ovale. Understand? Understood? So what is functional relation? And this otic ganglion would be hanging from which nerve? Mandibular nerve. That is its structural relation. That will be its structural relation. Okay, fine. This should be clear, huh? This should be clear now. And just tell me one thing. Just wait. Don't write anything. Just tell me one thing. What are these fibers? Postganglionic. These are the postganglionic fibers. What is this nervous system? This is the parasympathetic nervous system. So now, just do one thing. Turn the page. See mandibular nerve. Just turn the page. You have written mandibular nerve. Look there. Look the mandibular nerve which you have written. In the mandibular nerve, turn the page. See the mandibular nerve. See the auriculotemporal nerve. Look at the auriculotemporal nerve. See what you have written now. Auriculotemporal nerve. Got it now, all of you? Auriculotemporal nerve. What have we written? 1. Arises as 2 roots. The first thing we have written is it arises as 2 roots enclosing the middle meningeal artery. Fine. Second point what I have given you is it supplies the skin over the auricle and the temporal region. And now look at the third point. It also carries the postganglionic parasympathetic fibers from otic ganglion to parotid gland. You're following this? These are the postganglionic parasympathetic fibers from the otic ganglion to the parotid gland, and this would be carried by whom? This would be carried by auriculotemporal nerve. So these fibers are carried via auriculotemporal nerve. Auriculotemporal nerve doesn't mean auriculotemporal nerve is going to supply the parotid. No, auriculotemporal nerve just carries the fibers to parotid gland. Okay, is this clear to all of you? Understanding now? At least you should be able to get the subject. Okay, now I'll tell you the facial nerve. Once you understand this facial nerve, everything will be clear to you. The entire concept will be clear what I'm trying to tell you. Okay, starting with facial nerve. Have a look. Understand this now. Chill, I'll start. Listen. What is the facial nerve supply? What is the facial nerve supply? Listen here. Now do not write anything, just concentrate. What is the facial nerve supply? The facial nerve supplies all the glands in the head and neck except parotid. Fine, this we know. Like the glossopharyngeal nerve had a specific nucleus to supply the parotid. What was the name of that nucleus? Inferior salivary nucleus. Similarly, the facial nerve will also have a nucleus, specific nucleus to supply the glands of head and neck, and this is the superior salivatory nucleus. Understanding? So the superior salivatory nucleus is the nucleus of facial nerve to supply the glands, and there's a special nucleus for this gland. What's this gland? Lacrimal gland, and the name of the nucleus is lacrimatory nucleus. Okay, so understand one thing. What is the nucleus of facial nerve to supply the glands? Superior salivatory and lacrimatory. Which are the two ganglions related to the facial nerve? The pterygopalatine and submandibular. And what is the facial nerve supply? All the glands except parotid. That is tympanic branch of glossopharyngeal nerve is known as Jacobson's nerve. Tympanic branch of glossopharyngeal nerve is known as Jacobson's. Okay, starting now with the facial nerve. Understand this now, facial nerve. The name of the nucleus is superior salivatory nucleus. Superior salivatory nucleus. Sensory branch of facial nerve. Sensory branch of facial nerve. Superior salivatory nucleus is the nucleus of facial nerve, and this lacrimatory nucleus also. Okay, I'm not writing that. Okay, superior salivatory nucleus, sensory branch of facial nerve. The sensory branch of facial nerve is known as nervus intermedius. Nervus intermedius, or the nerve of Risberg. Nervus intermedius, or the nerve of Risberg. Okay, so superior salivatory nucleus, the sensory branch of facial nerve, is known as the nervus intermedius or the nerve of Risberg. This sensory branch joins with motor branch. Remember, sensory branch of facial nerve is a separate nerve. The motor branch of facial nerve is a separate nerve. Okay, so these are different things, and all this I'll show you in the brain. So sensory branch of facial nerve joins with the motor branch, forms trunk of facial nerve. Forms a trunk of facial nerve. Okay, just tell me one thing. Trunk of facial nerve. You'll understand. Just wait. This is difficult. Tell me now. Facial nerve enters into which foramen of the skull? Facial nerve enters into which foramen of the skull? One moment. I'll just make a full screen for you. Answer. Facial nerve enters into which? Facial nerve enters into which foramen of the skull? Yes. Okay, now better now. Facial nerve enters into internal acoustic meatus, right? Facial nerve enters into internal acoustic meatus. Internal acoustic meatus, along with the eighth nerve and the labyrinthine artery. The moment the facial nerve enters the internal acoustic meatus, where is it now? Where is the facial nerve now? It's right in the middle here. It's in the middle here. Okay, let's understand. That's the middle ear cavity. This is the middle ear cavity. This is the middle ear cavity. Okay. This is the middle ear cavity. Who's on this side? External ear. Who's on this side? Internal ear. That's the middle ear. This is the external ear. That's the internal ear. So if that's the middle ear and that's the internal ear on this side, if that's the internal ear on this side, tell me what is this wall of the middle ear? That's the medial wall of middle ear. Medial wall of middle ear. Okay. So that's the middle ear. That's the internal ear. What is this wall? Medial wall. The medial wall shows an elevation here. What's that known as? Promontory. On the promontory, you get a plexus here. What's that plexus known as? Tympanic plexus. Tympanic plexus. Okay. So now just try to understand this. The facial nerve enters into the internal acoustic meatus. The facial nerve is right in the middle here. Middle here. The facial nerve undergoes a bend. Bend. What is this bend known as? Genuine. The facial nerve now goes above the promontory, and the facial nerve now undergoes a second bend, second genuine. The facial nerve now goes behind the promontory and now gets a small opening here. What's that? Stylomastoid foramen. The facial nerve gets out of the stylomastoid foramen. Where's the nerve now? If you can answer this. The moment the facial nerve gets outside the stylomastoid foramen, where's the facial nerve now? Answer this. Where's the facial nerve? Once it gets outside the stylomastoid foramen, yes, it's right within the parotid gland. The facial nerve is right within the parotid gland. You understanding? The moment it gets out through the stylomastoid foramen, the facial nerve is right inside the parotid gland. This is what I was telling you. The parotid gland is placed in such a way here that the moment the facial nerve gets outside the stylomastoid foramen, it's right inside the parotid gland. Who's next to the facial nerve? The retromandibular vein. Who's next to the retromandibular vein? The internal carotid artery. And this becomes the contents of parotid gland. You're following this? This becomes the contents of parotid gland. Okay, now? Following now? I'll tell you once again. Look, understand this once again. The facial nerve enters the internal acoustic meatus. Understand this. The facial nerve enters the internal acoustic meatus. Where is it now? In the middle here. The facial nerve undergoes a bend, genuine, goes above the promontory, undergoes a second bend, second genuine, goes behind the promontory, gets out through the stylomastoid foramen, enters the parotid gland, and now gives 5 branches to supply the muscles of facial expression. Okay, clear with the course of facial nerve? Following all of you? Yes? Yes, sir. Fine, we'll trace the facial nerve now. Okay. Trace the facial nerve. So, superior sonati nucleus, sensory branch of facial nerve, trunk of facial nerve. Now, this will enter into the internal acoustic meatus. It would now enter the internal acoustic meatus. It would undergo a bend. What is that bend known as? Genu. But you know, this is ideally known as genu, but it is wrongly written as geniculate ganglion. It is wrongly written as geniculate ganglion. It's a misnomer. Ideally, it should be known as the genu. Facial nerve arises from the brainstem. Facial nerve will arise from the brainstem only. No, the nucleus is in the brainstem only. Nucleus is in the brainstem. All the nuclei of cranial nerves are in the brainstem only. So all the cranial nerves will begin from the brainstem. Understood now? Okay. So superior sonati nucleus, the sensory branch of facial nerve, joins with the motor branch, forms the trunk of the facial nerve, enters the internal acoustic meatus. It undergoes a bend, and what is that bend known as? Genu. Where are we? Where are we? We are in the middle ear, and in this middle ear, the facial nerve gives 3 branches. 1, the greater petrosal. You'll understand the entire facial nerve, and if this facial nerve is clear, you'll understand the lesions of facial nerve. Okay, this is very important clinically also. Greater petrosal nerve nerve to stapedius, and the third one is chorda tympani. Chorda tympani. Greater petrosal, nerve to stapedius, and chorda tympani. After giving these three branches, the facial nerve now gets out through, what is this foramen? Stylomastoid foramen. Enters a gland here, parotid, and now gives us 5 branches. Okay, so that's a parotid gland. This is parotid, huh? This is parotid. So in the middle here, the facial nerve gives 3 branches in sequence. The first, greater petrosal, the second, nerve to stapedius, and the third one is chorda tympani. After giving these 3 branches, the facial nerve now gets out through stylomastoid foramen, enters the parotid, and gives 5 branches to supply the muscles of facial expression. Okay, now we trace this. Trace the chorda tympani nerve. We trace the chorda tympani. Chorda tympani goes and joins with lingual. Now goes to the submandibular. Look who's come. Our ganglion has come, the submandibular ganglion, and would now supply the submandibular and the sublingual glands. Submandibular and the sublingual glands. You're clear with this? Genuous geniculate ganglion. Yes, that's a misnomer. It's a misnomer. Clear? So chorda tympani, this I told you, the chorda tympani goes and joins with the lingual, now goes to the submandibular ganglion, and the postganglionic fibers would now supply the submandibular and the sublingual glands. Is this clear? This is extremely important. So which is the ganglion which is going to supply the submandibular and the sublingual glands? The submandibular ganglion. The submandibular ganglion is going to supply the submandibular and the sublingual glands. And which is the nerve related to the submandibular ganglion? Facial nerve. Okay, I'll trace the other one. Trace the greater petrosal nerve. We trace the greater petrosal. Let me finish this, you'll understand everything. Greater petrosal joins with deep petrosal nerve. Greater petrosal joins with the deep petrosal nerve. And where does this deep petrosal nerve come from? Sympathetic plexus. The greater petrosal nerve joins with the deep petrosal nerve. The facial nerve itself goes to the parotid. The facial nerve gives 3 branches, and the one which is left, that would enter the parotid gland. Okay, it's not a branch, it's the main trunk of facial nerve. Okay, so greater petrosal nerve joins with the deep petrosal. And where does this deep petrosal nerve come from? The sympathetic plexus around the internal carotid artery. The sympathetic plexus together forms a nerve. This is the nerve of pterygoid canal. Nerve pterygoid canal, I'll tell you, just wait, also known as Wheaton's nerve. Genu is just a bend. Genu is just a bend of facial nerve, but that genu is written as geniculate ganglion. Okay. If I write a book, I will not write it as geniculate ganglion. I'll mention it as genu. Okay. So greater petrosal nerve joins with the deep petrosal nerve, forms nerve pterygoid canal or Wheaton's nerve. Now look who's come. Our ganglion has come, and this is the pterygopalatine ganglion, and the postganglionic fibers would now supply the lacrimal, nasal, palatine and pharyngeal glands. Lacrimal, nasal, palatine and pharyngeal glands. The postganglionic fibers would now supply the lacrimal, nasal, palatine and pharyngeal glands. Lacrimal, nasal, palatine and pharyngeal glands. I'll tell you, just one moment. Look, the facial nerve enters the internal acoustic meatus, undergoes a bend, that's genu, After the genu, the first branch is greater petrosal, the second branch is nerve to stapedius, the third branch is chorda tympani. And after giving the chorda tympani, the facial nerve now gets out through stylomastoid foramen. Now clear to all of you? Yes? Okay, let me finish this, then I'll tell you. Okay, look, this is so nice. Just try to appreciate this. Look, what is the meaning of all this? One moment here. What is the meaning of all this? Take my time. I draw with this now. Here. What is the meaning of all this? All this. Look. What is the meaning of all this? You've written a statement. You've written a statement. What is the meaning of all this? All the glands in the head and neck are supplied by facial nerve. That is the meaning of this. You're understanding? This is all the glands. This is the meaning of all the glands. All the glands in the head and neck are supplied by facial nerve. Now, why it does not supply the parotid? There's a reason for that. I'll tell you that later. There's a reason for that. Why it does not supply the parotid. Otherwise, all the glands in the head and neck are supplied by facial nerve. Now, if you can tell me, where is this located? Where is this located? In the brainstem. In the brainstem. From the brainstem to this ganglion. What are these fibers? What are these fibers? Preganglionic. What are these fibers? Postganglionic. What is this relation? What is this relation? Functional. Understood? Functional relation. Again. From the brainstem to this ganglion. From the brainstem to this ganglion. What are these preganglionic fibers? What are these postganglionic fibers? What is this relation? Functional. This is clear to all of you. This is what I'm telling you. The facial nerve is functionally related to two ganglions. The pterygopalatine, PPG is pterygopalatine, and the submandibular. Pterygopalatine and submandibular. Is this clear to all of you? This should be very clear. Huh? Maxillary nerve has got nothing to do with Regent's nerve. Maxillary nerve, where is the maxillary nerve here? Maxillary nerve is, it is just suspending the ganglion. It has got nothing to do with Regent's nerve. You understanding? Is this clear to all of you? But I'll make one easy representation for you. Then you'll be still better in a better position to understand this. Facial nerve does not supply the parotid. No, facial nerve does not supply the parotid. No. Before the geniculate ganglion is not preganglionic. Up to the pterygopalatine ganglion is preganglionic fibers. Up to the submandibular ganglion is preganglionic fibers. Understand? Okay. Okay, I'll show you one slide. एक minute. I'll just show you one slide. Everything will be clear to you. Have a look at this. One moment, you'll understand. Just give me 1 moment. Have a look at this slide. This is a very good slide. Stylomastoid foramen. Stylomastoid. Have a look at this slide. This is the best slide of netters. The best slide of netters. Okay, just have a look. I'll tell you that. Just wait. Facial nerve is a nerve second pharyngeal arch. Second. Facial nerve is a nerve second pharyngeal arch. That I've told you yesterday only. I told you that yesterday. One moment. Tell me this. Chalo, we'll start. Look, this is so nice. Tell me, what is this? Sorry. What is this ganglion? Chalo, start. You answer this now. You'll understand. Just give me 2 minutes. You'll understand everything. Tell me, what is this ganglion? Answer. This is the pterygopalatine ganglion, right? This is the pterygopalatine ganglion. What is this nerve from which it is hanging? What is that nerve from which it is hanging? This is the maxillary nerve, maxillary gland. What is this relation? The pterygopalatine ganglion is hanging from the maxillary nerve. What is this relation? Structural. Structural. You following? This is what I call as structural relation. Fine. What is this ganglion? Look at this ganglion. What is that? Submandibular ganglion. That's a submandibular ganglion. What is this nerve? What is this nerve? That's the lingual nerve. So the submandibular ganglion is hanging from the lingual nerve. What is this relation? What is this relation? Structural. Structural. You following? What is this ganglion? This ciliary ganglion. Ciliary. And what is this nerve? What is this nerve? That's the nasociliary nerve. What is this relation? Structural. Structural. Following? And just one last ganglion. This one last ganglion. Okay. What is this ganglion? This one. Otic ganglion. And what is this nerve behind the otic ganglion? This is the mandibular nerve. Mandibular nerve. This is structural relation. Structural relation. Is this clear? What is structural relation? The ganglion is just hanging from the nerve. That is the meaning of structural relation. Okay. Now, now understand this. This is the facial nerve. Facial nerve. The facial nerve is entering into this foramen. What is this foramen? Internal acoustic meatus. The facial nerve enters the middle here. Look, enters the middle here. That's the first bend. This is what I'm telling you. That's the first bend. Genuine. The facial nerve now goes like this, like this, like this. That means it is going above the promontory. It's not seen here. That's the second bend of facial nerve. What's the second bend known as? Genuine. And now it gets out through this foramen. What's that? Stylomastoid foramen. Now what would this gland here be? Parotid gland. Then it enters the parotid gland. You're following this? The facial nerve enters the internal acoustic meatus, enters the middle here. That's the first bend, genu. Now that is the second bend, genu, and now gets out through stylomastoid foramen. Okay. In the ear, the facial nerve gives this branch. Look, what's this? This is the chorda tympani. The chorda tympani goes and joins with what? Look at this. It goes and joins with the lingual. Now this chorda tympani will go to the submandibular ganglion, and it would now supply two glands. What are that? Submandibular and sublingual glands. You understanding this now? Following now? Okay. What is this branch of facial nerve? This is the greater petrosal nerve. Just have a look at this. The greater petrosal nerve comes from behind the artery. That's the greater petrosal nerve which is coming from behind the artery. What is this artery here? That's the internal carotid artery. And what is this white plexus? What is this plexus? That's the sympathetic plexus. From this sympathetic plexus, we get a nerve here. Look at this. What is this nerve? That's the deep petrosal nerve. The deep petrosal nerve will join with the greater petrosal nerve and now form what? What is this nerve now? This is the Vidian's nerve. Vidian's nerve. On the nerve pterygoid canal, it will come to a ganglion. What is this ganglion? Pterygopalatine ganglion. And now this postganglionic fibers would supply the nasal glands, the palatine glands, the pharyngeal glands, and the lacrimal gland. Lingual nerve is structural. Functional is chorda tympani, no. Chorda tympani is going to the submandibular ganglion, no. So functional would be chorda tympani. That's facial, no. Chorda tympani is a branch of facial nerve. Chorda tympani is a branch of facial nerve. This should be clear now. No confusion in this. This should be clear. Now I'll tell you something else. Why does you are asking me facial nerve enters the parotid gland and why it does not supply the parotid? There's a reason for that. Facial nerve just enters the parotid gland. It is not supplying the parotid gland. And then it gives 5 branches which supplies the muscles of facial expressions. Okay. Parotid gland is supplied by whom? Glossopharyngeal nerve. Remember this. Is this clear to all of you? Yes, Vidian's nerve is the same nerve as vasomotor rhinitis. You do a Vidian's neuroanatomy. Okay, so that's the Vasomotor rhinitis. Okay, this is parasympathetic nervous system, and this should be perfect with all the ganglions. With look, I'll just make one easy representation for you. Easy representation. You should be able to answer this for me. Just have a look. Don't get confused. No confusion. I'll just make an easy representation. See if you can answer this. Yes. Okay, look here. Tell me. Look, one moment. Tell me, what is this ganglion here? I make this as otic ganglion. This is the otic ganglion. Just a representation for you. Otic ganglion. What is this nerve which is going to suspend the otic ganglion? What is the nerve which is going to suspend the otic ganglion? Mandibular nerve. Mandibular. And which is this nerve? Which is this nerve going to be? Which will enter the otic ganglion, relay in the otic ganglion, and send postganglionic fibers. So what is this nerve? Glossopharyngeal nerve. You understanding now? What is structural and what is functional? This is functional and this is structural relation. See, don't ask such silly questions. What is the meaning of this? You tell me. Muscles of the facial expressions are not sympathetic. Autonomic nerve supply nahi hai wo. I told you the cranial outflow of parasympathetic nervous system supplies only the glands. The muscles of the pharyngeal arches face is derived from the second pharyngeal arch. So that is a different thing. Chorda tympani also supplies the tongue. Yes. Chorda tympani supplies the submandibular sublingual gland. Chorda tympani supplies the tongue also. These are different fibers in the nerve, in the chorda tympani nerve. Okay, fine. Okay, clear. I'll just proceed now. I'll proceed. Understand this now. Something important I'm telling you now. Just try to concentrate. Something very important. Yes. Okay, just wait. Let me finish this. Have a look. Have a look now. Understand this. Concentrate. Now do not write anything. Concentrate. I hope you've understood the parasympathetic nervous system. Now don't type anything. Just listen to what I'm telling. This is another difficult thing. And if you understand this, you understand the brain. So you have to understand this. Okay, I start. Chalo. Now, look. Facial nerve. I'll start with glossopharyngeal nerve. Glossopharyngeal nerve supplies the parotid gland. We know this. Glossopharyngeal nerve is a nerve third pharyngeal arch. In the third arch, there's only one muscle there. What's that? Stylopharyngeus muscle. Stylopharyngeus. So glossopharyngeal nerve supplies the stylopharyngeus muscle. Glossopharyngeal nerve supplies the tongue. Okay. So now, there's a specific nucleus of the glossopharyngeal nerve to supply the parotid gland. There is a specific nucleus of glossopharyngeal nerve to supply the tongue. There is a special nucleus of the glossopharyngeal nerve to supply the stylopharyngeus muscle. Now, I'm starting with this. Have a look. I'm starting with functional components of the nucleus. Functional components of the nucleus. Functional components. This is a difficult topic. Understand this. Now see, there's a cranial nerve. There's a cranial nerve, XYZ. Any cranial nerve, XYZ. And this cranial nerve has to supply the muscles of pharyngeal arches. Okay. Listen here. Do not type anything. Just concentrate. This is difficult. Don't sit and type, otherwise later you'll not understand this. And these topics are difficult to tell again and again. Look, there's a cranial nerve. And this cranial nerve has to supply the muscles of facial expressions. This cranial nerve should have a component in its nucleus. This cranial nerve should have a component in its nucleus. What I'm telling you is the functional component of the nucleus. You remember GSE, GVE, SSE, general somatic efferent, special somatic efferent, general visceral efferent, all these things. Okay, slightly difficult. Okay, you'll understand. Just one moment. Okay, I'll start. Look here. There's a cranial nerve, and this cranial nerve has to supply the muscles of facial expression. This nerve cannot just go and supply the muscles. It cannot just go and supply the muscles. Otherwise, all the cranial nerves would supply the muscles of pharyngeal arches. Now, this nerve should have a component in its nucleus. What is the name of this component? Special visceral efferent. SVE, special visceral efferent. So, special visceral efferent. What does this component supply? Just understand this. Special visceral efferent. Okay, this component is going to supply the muscles of pharyngeal arches. Fine, understood. This component is going to supply the muscles of pharyngeal arches. Now, if any nerve has to supply the muscles of pharyngeal arches, it should have this component in its nucleus. What is the name of the component? Special visceral efferent. Now tell me, which are the nerves of the pharyngeal arches? The nerve of the first arch, this you have written yesterday. Nerve of the first arch, mandibular. Nerve of the second arch, facial. Third arch, glossopharyngeal. Fourth arch, superior laryngeal and sixth arch is recurrent laryngeal. That means these are the nerves of the pharyngeal arches. That means this component, special visceral efferent, would be present in which cranial nerves? 7, 5, 7, 9 and 10 cranial nerves. 5, 7, 9 and 10 cranial nerves. You following? What is the name of this component? Special visceral efferent, and this component supplies what? Muscles of the pharyngeal arches. So any nerve which is going to supply the muscles of the pharyngeal arches will have this component in its nucleus. So which are nerves of the pharyngeal arches? 5, 7, 9 and 10. So this component will be present in these nerves. You'll understand it. It takes time. Just be with me. Now there's another component. And this component is going to supply the glands. Okay, this component supplies the glands. What is the name of this component? General visceral efferent. GVE, general visceral efferent. What does this component supply? It supplies the glands. So now, if any nerve has to supply the glands, it should have this component in its nucleus. You understanding? Name of the component? General visceral efferent. What does it supply? Glands. And now we know which are the nerves which supply the glands. 7, 9 and 10. So this component would be present in which cranial nerves? 7, 9 and 10 cranial nerves. So this is how you understand the functional components of the nucleus, and then it will be easy for you. So all these things you'll understand as we proceed. So starting with this, functional components of the nucleus. I tell it is difficult so that you people can concentrate. Anyway, nothing is difficult. Things are difficult, but they are not impossible. I keep on telling it is difficult because, then someone will keep on writing, someone will keep on typing. That is why I tell these things. Okay, not to scare you. Fine. Starting with this now. Functional component of the nucleus. What happens is someone keeps on typing, someone keeps on chatting, someone keeps on talking. That is why I tell it is difficult, because I don't repeat all these things again and again. Understand? And then I don't like someone telling I didn't understand that, I didn't understand this. So that is why beforehand tell it is difficult. Doesn't mean that you will not understand it. Clear? Functional component of the nucleus. Start. First, special visceral efferent. Special visceral efferent. I'll summarize it quickly. Just wait, you'll understand. Special visceral efferent. What does this component supply? Right on. Supplies the muscles of pharyngeal arches. Supplies the muscles of pharyngeal arches present in five, 7, 9 and 10. cranial nerves. Present in 5, 7, 9 and 10 cranial nerves. The common nucleus for 9, 10. And who's this and? The common nucleus for 9, 10 and. Wait, I'm telling you. The common nucleus for 9, 10 and. Who's this and? 7? No. It's not 7. Otherwise, I would have said 7, 9 and 10. I would have said 7, 9 and 10. No, it is definitely not 7. So the common nucleus for 9, 10 and 11. 11. Accessory nerve. But which 11? Which 11? Cranial accessory. So the common nucleus for 9, 10 and cranial accessory. This is what I was telling you. Understanding now? The cranial accessory arises in the brainstem along with the 9, 10 and 11 cranial nerves. And the spinal accessory arises in the spinal cord outside the skull. And this spinal accessory has to join the cranial accessory. So how does it enter the skull? Through foramen magnum. It searches the cranial accessory, joins with the cranial accessory, forms a complete accessory nerve, and this accessory nerve now gets out through jugular foramen. Okay, that's how it is. The common nucleus for 9, 10 and cranial accessory is nucleus ambiguous. Nucleus ambiguous. A-M-B-I-G-U-E-S. Nucleus ambiguous. Okay. General visceral effect. General visceral effect. General visceral effect supplies the glands. Represents the cranial outflow of parasympathetic nervous system. General visceral effect supplies the glands, represents the cranial outflow of the parasympathetic nervous system present in 3, 7, 9 and 10 cranial nerves. Present in 3, 7, 9 and 10 cranial nerves. There's a common nucleus for 3 nerves, 9, 10 and cranial accessory. And what is that? Nucleus ambiguous. It's a common nucleus. Okay, for the 3 nerves. That's nucleus ambiguous. Yes. Now one query you'll have: how does 3 come here? Very good. How does 3 come here? Yes, I want you to ask that. Very good. So I purposely not told you that. Very fine. Very good. Third nerve does not supply any glands. Fine. Very nice. You got it. Third nerve does not supply any glands, and this component is going to supply what? Glands. Fine. General visceral efferent component, what does it supply? Glands. Which nerve supplies the glands? 7, 9 and 10. But see the second point which I have given you. What does this component represent? It represents the cranial outflow of the parasympathetic nervous system. And that is why we take the third nerve into this. See the second point. What does this component represents? The cranial outflow of the parasympathetic nervous system. And that is why we take the third nerve into this, even though third nerve does not supply any glands. Am I clear? So that's it. So third nerve does not supply any glands, but this component, see the second point, this component represents what? The cranial outflow of the parasympathetic nervous system. Clear? So that's how the third nerve supplies the glands. That's why the third nerve is included in this component. I'm sorry. Clear to all of you? Okay. The 11th joins with the 10th. The 11th, it goes with the 10th. It supplies the muscles, the cranial axis. Clear to all of you? Now understand it. Look. 10th nerve supply which gland? Arey, you have written all this. You have written all this. You have written this. Don't ask me what things I've given you in writing. You have written it. What glands is the vagus supply? I've already given you all this. Okay, look, I'll make it simple now. Look how easy and how simple it is. I start. Listen here now. Do not write anything. Listen here. Do not write anything. Okay, I start. Now, if you know what a nerve is going to supply, automatically you know the components of that nerve, components of that nucleus of nerve. If we know what a nerve is going to supply, we know the components of the nucleus of the nerve. Say for example, I start with glossopharyngeal nerve. That's very easy to understand. Glossopharyngeal nerve. What is the glossopharyngeal nerve supply? Chalo, you understand this and answer. Glossopharyngeal nerve supplies the stylopharyngeus muscle. Fine. Glossopharyngeal nerve supplies the stylopharyngeus muscle, which is a muscle of third pharyngeal arch. It's a muscle of third pharyngeal arch. And to supply the stylopharyngeus muscle, the muscle of third arch, what component should the glossopharyngeal nerve have in its nucleus? What component should the glossopharyngeal nerve have in its nucleus? Special visceral efferent components. So what are the components of glossopharyngeal nerve? 1. General special visceral efferent. And what is this component supply? The stylopharyngeus muscle. Stylopharyngeus muscle. Fine? Okay. What else is the glossopharyngeal nerve supply? What else? It supplies the gland, parotid. And to supply the gland, what component should the glossopharyngeal nerve have in its nucleus? General visceral efferent. General visceral efferent. Understanding? So what are the components of glossopharyngeal nerve? 1. Special visceral efferent dash supplies the stylopharyngeus muscle. 2nd, general visceral efferent supplies the parotid gland. You're getting this now? You're understanding this? Yes, clear? Same with the facial nerve. Same as with the facial nerve. Facial nerve supplies all the glands except parotid. So what component should it have? General visceral efferent component. Facial nerve supplies the muscles of second pharyngeal arch. So what component should the facial nerve have? Special visceral efferent. Special visceral efferent. Okay, you're getting this? Understanding this? Now you tell me. When the facial nerve supplies so many glands, so many glands it supplies, and then when it is passing through the parotid, the facial nerve is right inside the parotid. I told you, it is a content of parotid gland. Why does it not supply the parotid? You understanding this? When facial nerve can supply so many glands, and when it is right within the parotid gland, still it is not able to supply the parotid. There's a reason for that. And the reason is based on this components, what you've written. Okay. See, the explanation given is like this. You got the thing which I'm telling you, no? You understood the point which I'm telling you? Facial nerve supplies all the glands. And then when it is passing through the parotid, why is it not supplying the parotid gland then? So, see, the explanation is like this. Fine. After supplying so many glands, the component which the facial nerve has to supply the glands is over exhausted. The facial nerve doesn't have this component anymore. The component to supply the gland is over. Now there's only one component which the facial nerve have with it. What is that? What is that? the special visceral efferent component. And this component, and when the facial nerve is passing through the parotid gland, it is having only this component with it. What is the name of this component? Special visceral efferent component. And what is this component going to supply? Only the muscles. And look, this is so nice. The facial nerve now gives 5 branches, and these 5 branches are going to supply the muscles of facial expressions. You understanding this? And that is why even though the facial nerve is passing through the parotid gland, it is not able to supply the parotid. It is not able to supply the parotid gland. Is this clear to all of you? See the slide and tell me. Answer this MCQ. In the substance of the gland. Very good. It's in the substance of the gland. Very nice. So what is the meaning of branchiomotor component? Clear now? What is the meaning of branchiomotor component? Branchiomotor component is the special visceral efferent component. Special visceral efferent. Okay. And this special visceral efferent component, when it is passing through the parotid, the facial nerve is right in the substance of parotid gland. It's not deep to the parotid, it's not superficial to the parotid. It's right in the substance of the parotid gland. And when the facial nerve is passing through the parotid, which component is left with it? The branchiomotor component, the special visceral efferent component. When would the answer be none? If you can just tell me, when would the answer be none? What would the question be? What would the question be? When would the answer be none for this? How do you modify the question? How do you modify the question then? When would the answer be none? Tell me, how would you frame the question then? General, special nahi. General, yes. What is the relation of general visceral efferent? That general visceral efferent is also known as secretomotor. I didn't tell you. Secretomotor. I didn't tell you that secretomotor. What is the relation of GVE, general visceral efferent, or secretomotor component of facial nerve to the parotid gland? Your answer would be none. None. Okay, that's nice. Very good, very good, very good. You've understood this? Very nice. Very nice. Okay, that's great. Just one last component left for me. I'll just finish that component. The third one is general somatic efferent. General somatic efferent component supplies the muscles derived from occipital myotomes. Yes, very good. Very good, you understood this. General somatic efferent component supplies the muscles derived from occipital myotomes or somites. A nerve can have 3-4 components simultaneously. Nerve can have many components, 3-4 components simultaneously. I'll tell you, just wait, I'll tell you. Depending on what the muscle nerve supply, the components are like that. Okay, supplies the muscles derived from occipital somites or myotomes. Now, which are these muscles? These are the extraocular and tongue muscles. Tongue muscles. The muscles derived from occipital maritomes are extraocular and tongue muscles. You remember which muscles are derived from cervical maritomes? If you remember this, tell me the muscles derived from cervical maritomes are what? Muscles derived from cervical maritomes. Which are the muscles derived from cervical maritomes? Answer, answer, answer. Which are the muscles derived from cervical maritomes? The muscles of diaphragm. You remember the muscles of the diaphragm are derived from cervical maritomes or cervical somites. And which are the muscles derived from occipital maritomes? The extraocular and tongue muscle. So tell me now, this component would be present in which cranial nerves? This would be present in 3, 4, 6 and 12 cranial nerves. 3, 4, 6 and 12 cranial nerves. Okay. 3, 4, 6 and 12 cranial. I'll tell you one more component. Special visceral afferent. Otherwise this I'll tell you later. I'll tell you this in the brain. I'll tell you. Okay, clear to all of you? See, I'll give you one more example. Facial nerve. So how to understand the components? If you know what the nerve is going to supply, to understand the components of that nerve, of that nucleus of the nerve. Okay, quickly tell me, what does the facial nerve supply? Okay, facial nerve. Facial nerve is a nerve which pharyngeal arch? Second. Facial nerve is a nerve second pharyngeal arch, and to supply the muscles second pharyngeal arch, what component should the facial nerve have in its nucleus? Special visceral efferent. So what are the components of facial nerve? 1. Special visceral efferent supplies the muscles of second pharyngeal arch. What else is the facial nerve supply? The facial nerve supplies all the glands except parotid. So what is the component which the facial nerve would have? General visceral efferent. You understanding? So this is how the components you have to understand. All this nucleus I'll be telling you later. Nucleus will be discussing in the brain, don't worry. But at least some things are clear to you. Brain will be discussing all the nucleus and all. It will be clear to you. Okay. Fine. Now, some MCQs I'll tell you. Some MCQs. Stylopharyngeus is a muscle of third pharyngeal arch. Third. Which is the safety muscle of the tongue? Clear to all of you, they should be perfect. Which is the safety muscle of the tongue? Safety muscle of the tongue. Okay, I'll just tell you some MCQs. Tensor of vocal cords. Answer this. Tensor of vocal cords. Safety muscle of tongue is genioglossus. I'll tell you some MCQs. Tensor of vocal cords is cricothyroid. Tensor of vocal cords is cricothyroid supplied by external laryngeal nerve. Supplied by external ENT topics, I'm just telling you the MCQs. Supplied by external laryngeal nerve. And if this cricothyroid is damaged, just one moment. Okay, just tell me, if this cricothyroid is damaged, what happens? If the cricothyroid is damaged, the tensor action of the vocal cords is lost. Tensor action of the vocal cords is lost. The person talks in a very low-pitched voice. When the vocal cords are tense, the pitch of the voice is raised. Pitch of the voice is raised. We talk in a very high-pitched voice when the vocal cords are tensed. Right. Right. If this cricothyroid is damaged, the tensor action of the vocal cords is lost. The person talks in a very low-pitched voice, and this is known as loss of timbre. Loss of timbre. Loss of timbre. That's a loss of timbre of the voice. Okay. Abductor of vocal cords. Just one moment. Just hanging. Just one moment. हेलो हाँ वो गया, उसको वापस दिला दो, वो वन नोट वाला, उसको वापस ले लो. Okay, sorry for that. So tensor of the vocal cords is cricothyroid, and this cricothyroid is supplied by external laryngeal nerve. Damage results in loss of timbre of the voice. Tensor of the vocal cords. Okay, so when the vocal cords are tensed, we get a pitch to the voice, a high-pitched voice. A high-pitched voice is because of the tensor action of the vocal cords. And if this vocal cords are paralyzed, the tensor action is gone. If the cricothyroid is paralyzed, the tensor action is gone. The person talks in a very low-pitched voice, and this is known as loss of timbre of the voice. This was an MCQ, loss of timbre, T-I-M-B-E-R. Abductor of vocal cords. Abductor of vocal cords. These are some MCQs. This is the posterior cricoarytenoid. Posterior cricoarytenoid. Okay. Next. Safety muscle of the tongue. Safety muscle of the tongue. Genioglossus. Safety muscle of the tongue is genioglossus. It protrudes the tongue to opposite side. It protrudes the tongue to opposite side. Remember, genioglossus protrudes the tongue. It protrudes the tongue, but to the opposite side. Genioglossus protrudes the tongue, means the right genioglossus will protrude the tongue to the left, and the left genioglossus will protrude the tongue to the right. And that is why when there's a lesion of hypoglossal nerve, suppose if there's a lesion of right hypoglossal nerve, the right genioglossus is paralyzed, the left genioglossus becomes powerful, and the left will deviate the tongue to the right side. And that's how in lesions of hypoglossal nerve, the tongue is deviated to the same side of lesion. Same side, that's because the genioglossus protrudes the tongue to the opposite side. Okay, in lesions of hypoglossal nerve, tongue deviates to same side of lesion. In lesions of hypoglossal nerve, the tongue will deviate to the same side of lesion. Break, let me see, 2 o'clock, if I can give you a break. Okay, so the tongue deviates to the same side of lesion. I'll start with this now, have a look. Starting with this part of head and neck. Now listen. Now, I told you that day, when the embryo was folded like this, folded, what was the first thing on the ventral side of the embryo? What was the first thing down here? That was the septum transversum. And this septum transversum helps in the formation of what? Diaphragm. The next one is the heart, the developing heart. The next one is the procaudal plate. And the next is the neural tube here. Okay, that means the procaudal plate or the mouth lies between the developing heart and the developing brain. There's no neck, and now we get a series of arches here. What are these arches known as? Pharyngeal arches. And these pharyngeal arches are going to form the head and the neck. Okay, they are going to form the head and the neck. Now, each pharyngeal arch, you tell me what is this slide. Look at this slide and tell me what is this view. Look at this slide. This is a section taken like this. A section taken like this through the neck. What is this from outside? From outside, this is the ectoderm. And what is this from inside? That's the ectoderm. Okay, so each pharyngeal arch from outside is lined by what? Ectoderm, and from inside will be lined by what? Endoderm. What we call this as the ectodermal clefts, and from inside it would be known as the endodermal pouches. Endodermal pouches. This is the ectodermal clefts, from inside that's the endodermal pouches. And one moment. This is the ectoderm, this is the endoderm, and what's this in between? Mesoderm. In between is the mesoderm. Clear? So from outside, this is ectoderm, and the ectoderm will dip here. It will invaginate here. This is known as the ectodermal clefts. Ectodermal clefts, and this is known as the endodermal pouches, like this. So from outside, this is ectodermal clefts, and from inside, that's endodermal pouch. And in between is the mesoderm. You're following this, what I'm saying? Look, just try to understand. Look, suppose if that's the GIT, this glass is the GIT. Glass is the GIT. So what's this glass lined from inside by? Inside, endoderm. And what's this here? Outside, this side here. What is this from outside? Ectoderm. So this from outside is ectoderm. This from inside is endoderm. And what is this? Mesoderm. Same on this side now. Same on this side. Outside is ectoderm, between is mesoderm, inside is endoderm. And now you join this. You join this now. You carry the ectoderm on this side, like this. Ectoderm on this side. You carry the mesoderm on this side. And who's this inside? Endoderm. This becomes one pharyngeal arch. One pharyngeal arch. You understanding? That means each pharyngeal arch from outside would be lined by ectoderm. Between is the mesoderm, and inside is the endoderm. Following this? Is this clear? Starting with embryology of head and neck. This is embryology of head and neck. Now you have to know what happens to this ectodermal clefts, what happens to this ectodermal clefts, and what happens to this endodermal pouches. Okay, I'll start with this ectodermal clefts, endodermal pouches. Look at this. If you can hear the hours, you understand this now. See this line, it will be clear to you. See this line. What is this now? What is this? This is the GIT. That's the GIT. So what is this from inside? What is this from inside? Endoderm. And what is this from outside? That's the ectoderm. So this is known as ectodermal clefts. And what is this from inside? Known as endodermal pouches. And what is this in between? Mesoderm. So what I'm telling you now, you take the ectoderm on this side, you carry the ectoderm on this side like this. You carry the mesoderm on this side. And who's this from inside? Endoderm. So now this becomes one pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth pharyngeal arch. You understanding this now? This is a sagittal section which I just showed you. This was a sagittal section. Sagittal section like this. This was a sagittal section taken like this. Fine. So now you have to know what happens to this ectodermal clefts and what happens to this endodermal pouch. I'll start. This is the easiest part. Embryology of head and neck is the easiest to understand. Now, what happens to the first ectodermal cleft? The first ectodermal cleft forms the external acoustic meatus. External acoustic meatus. The first ectodermal cleft forms the external acoustic meatus. The second ectodermal cleft grows down, and fuses with the last one. The second ectodermal cleft grows down and fuses with the last one. So all these clefts will go below this. All these clefts have gone below this. Our neck is smooth. Because the second ectodermal cleft goes and fuses with the last one. But suppose if it doesn't fuse with the last one, we get the small opening here on the anterior border of sternocleidomastoid. And what is this opening known as? This is what we call as a branchial sinus. Okay. So this is what we call as a branchial sinus. Look, this is the branchial sinus on the anterior border of sternocleidomastoid. You're following this? So if the second ectodermal cleft does not fuse with the last one, you get an opening on the anterior border of sternocleidomastoid, and this is known as a branchial sinus. But suppose if this becomes a fistula, one opening of the fistula will be on the anterior border of the sternocleidomastoid. The second end of the fistula, if you trace fistula, one opening will be here, and if you trace this fistula, the second opening will be in the region of second endodermal pouch. Okay, it will open in the region of second endodermal pouch. And what is derived from the second endodermal pouch? Look, what is derived from the second endodermal pouch? The palatine tonsil. And that is why if it's a branchial fistula, outside it opens on the anterior border of sternocleidomastoid. Inside it opens in the palatine tonsil. Special visceral afferents, now I'll tell you in the brain. I've purposely not told you. This is sagittal section. How is it? Yes, this is coronal section. I'm so sorry. Coronal section, not sagittal. Yeah. Coronal section. Yeah. Sagittal would be like this. Yes, very good. So this is a coronal section. Coronal. Fine. Yes, very good. Starting with ectodermal clefts. We just have to know this. It's a coronal section. Sagittal would be like this, coronal would be this. Okay. So ectodermal cleft, first ectodermal cleft forms external acoustic meatus. Second grows down and fuses with the last. Grows down and fuses with the last. Grows down and fuses with the last. The neck thus becomes smooth. Okay, fine. Clear? So the first ectodermal cleft forms the external acoustic meatus. The second ectodermal cleft grows down and fuses with the last one. The neck becomes smooth. If it does not fuse, it results in branchial sinus or fistula. Branchial sinus or the fistula. Video is clear. It just joins with the last one. It fuses with the last one. There's nothing it forms. It just fuses with the last one. Clear? So that's about the ectodermal clefts. The first ectodermal cleft forms the external acoustic meatus. The second grows down and fuses with the last one. If it does not fuse, it results in branchial fistula or a sinus. Now understand what happens to the endodermal pouches. Have a look. Don't write this. I'll tell you this. Don't write. Endodermal pouches. Look, what is this view? This is the GIT and this is the endoderm. So these are the endodermal pouches. What was this from outside? From outside is the ectoderm. And what's this in between? Mesoderm. Clear? Okay. I'll start here. Now, the first endodermal pouch. Listen here, don't write anything. The first endodermal pouch divides into a dorsal and a ventral part. The dorsal is known as the tubotympanic recess. The dorsal forms the tubotympanic recess, and this part is going to dilate. The tubotympanic recess, this part is going to dilate and form the tympanic cavity. This will form the tympanic cavity, and this is going to be a tube. And what is this tube going to be? Tympanic cavity is the middle ear cavity, and this tube is the eustachian tube. Okay. So the first endodermal pouch forms what is known as the tubotympanic recess. The first endodermal pouch forms the tubotympanic recess. Just one moment, it is gone again. Here we are. Clear now? Okay, look at this. The first, I'm starting here once again. Look here, the first endodermal pouch divides into a dorsal part and a ventral part. The dorsal part, don't write this, I'll give you this. The dorsal part forms the tubotympanic recess, which forms the tympanic cavity and the eustachian tube. The ventral part of the first goes down and joins with the second to form what? Palatine tonsil. The ventral part of the first fuses with the second to form the palatine tonsil. Okay, so we'll make it like this. Starting with endodermal pouches. Endodermal pouches. Starting with the first endodermal pouch. First, make two arrows. Dorsal, ventral. Dorsal forms the tubotympanic recess, which forms tympanic cavity and eustachian tube. Tympanic cavity and the eustachian tube. The ventral joins with the second and forms palatine tonsil. Ventral joins with the second and forms the palatine tonsil. Clear to all of you? Branchial fistula can be anywhere, no? On the anterior bottom sternocleidomastoid, it can be anywhere. Clear? I am going fast here. Second endodermal pouch. Second endodermal pouch joins with ventral part of the first and forms palatine tonsil. Okay, that's the same one, no? So the second will join with the ventral part of the first and form the palatine tonsil. Third again divides into a dorsal and a ventral. Third endodermal pouch divides into a dorsal and ventral part. The ventral forms the thymus and the dorsal forms the inferior parathyroid. Inner end will be palatine tonsil or the tonsillar fossa. Clear? So the ventral part of the first forms the thymus, the ventral part of the third forms the thymus, and the dorsal part would form the inferior parathyroid. Fourth, again forms two parts, dorsal and ventral. Dorsal and ventral. Dorsal forms the superior parathyroid. Dorsal forms the superior parathyroid and ventral forms the ultimobranchial body. Ultimobranchial body forms parafollicular C cells of thyroid. Ventral forms the ultimobranchial body. The fourth and the sixth, they will fuse. The fourth and the sixth fuses. So don't ask me what will happen to the sixth one. The fourth fuses with the sixth one. So the fourth divides into a dorsal and ventral part. The dorsal forms the superior parathyroid and the ventral fuses, the ventral forms the ultimobranchial body. The ultimobranchial body forms the parafollicular C cells of thyroid. But you remember, where have I told you the parafollicular C cells? Somewhere else? Neural crest cells, yes. Recently it has been shown that the parafollicular I'll tell you this, the parafollicular C cells are derived from neural crest cells. If neural crest cells is not in the option, the second option is going to be ultimobranchial body. Okay, just remember that. I'll show you the slide, have a look at this, it will be clear. I'll repeat that, just wait. See the slide, it will be clear. Okay, look at this. Here, that's slide. Say this is the slide, have a look. See the slide. See the slide. Okay, so look here. This is the first endodermal pouch. The first endodermal pouch divides into a dorsal part, dorsal and a ventral. The dorsal part forms what? The tubotympanic recess. The tubotympanic recess forms the middle ear cavity and the eustachian tube. The ventral joins with the second, this is the second, and forms what? Palatine tonsil. The ventral joins with the second and forms the palatine tonsil. Clear to all of you? What happens to the second endodermal pouch? The second joins with the ventral part of the first and forms the palatine tonsil. Okay? Now, this is the third one. The third one divides into a dorsal and a ventral part, dorsal and ventral part. What happens to the dorsal? The dorsal forms the inferior parathyroid. It forms the inferior parathyroid, and the ventral would go down and form what? Thymus. The ventral forms the thymus. Sorry. Yeah. The ventral forms the thymus. Sorry for that. Okay. Just be finishing it, huh? Just 2-3 minutes. The 5-10 minutes. Okay, look here. The third endodermal pouch divides into a dorsal and ventral part. Okay, the third endodermal pouch divides into a dorsal and ventral part. The dorsal forms the inferior parathyroid, that's inferior parathyroid, and the ventral forms the thymus. This is the thymus. Okay, and the fourth endodermal pouch joins with the sixth, divides into a dorsal and a ventral. The dorsal is going to form the superior parathyroid, and the ventral forms, this is the ultimobranchial body. And the ultimobranchial body forms what? The parafollicular C cells of thyroid. But again, I'm telling you, this, I'll finish this, then you take a break. Okay, clear to all of you? So if you get the MCQ, parafollicular C cells of thyroid are derived from, your first answer would be neural crest cells. If not in the option, the second answer is going to be the ultimobranchial body. Clear to all of you? Okay. Just 2 more things I have to tell you. Okay. Clear to all of you? Now see here. Tell me. What is this? These are the ectodermal clefts. These are the ectodermal clefts, and these are the endodermal pouches. Same here, endodermal pouches here, and these are the ectodermal clefts here. And if we join this becomes one pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth, sixth pharyngeal arches. Okay. Now, in the first pharyngeal arch, this is extremely important. Understand this. In the first pharyngeal arch, we get two swellings here. What are these two swellings known as? Lingual swellings. And you get another swelling here. What is this known as? Tuberculum impar. So these are the two lingual swellings. Just wait. And this is known as the tuberculum impar. So two lingual swellings and the tuberculum impar forms what? Anterior 2/3 of the tongue. Anterior 4 joins with 6th. Okay, so two lingual swellings and tuberculum impar forms the anterior 2/3 of the tongue. Anterior 2/3. In the third and the fourth arch, what is this prominence known as? This is known as the hypobranchial eminence. Or this is also known as the cupula, hypobranchial eminence of cupula, and this divides into two parts. This is a cranial part and this is a caudal part. Cranial part and caudal part. The cranial part of hypobranchial eminence forms what? The cranial part is going to form the posterior 1/3 of the tongue. Posterior 1/3 of the tongue is derived from cranial part of hypobranchial eminence. Cranial. And the posterior most part of the tongue. The second joins with the ventral part of the first. Yes, that's right. And this caudal part of the hypobranchial eminence is going to form what? The posterior most part of the tongue and epiglottis. Posterior most part of the tongue and epiglottis. So that's about the development of tongues. You just draw this. Who's going down? Yes. Who's going down? The fifth disappears now. The fifth is disappeared off. The fourth and the sixth. The fourth and the sixth, they fuse together. It is easy. This is very easy. You get MCQs like this. Thymus is derived from the ventral part of the third endodermal pouch. The inferior parathyroid is derived from the dorsal part of the third endodermal pouch. The superior parathyroids are derived from dorsal part of the fourth endodermal pouch, like that. The palatine tonsil is derived from the first and the second pouch. The second and the ventral part of the first. And the first dorsal part forms the tubotympanic recess, which forms the middle ear cavity and the eustachian tube. It's like that. Cranial part of hypobranchial eminence. I'll write this down for you. I'll write that, just wait. You're done with the slide? Hypobranchial eminence. Okay, we'll make it like this. Anterior 2/3 of the tongue derived from two lingual swellings and tuberculum impar. Anterior 2/3 of the tongue is derived from two lingual swellings and tuberculum impar. Posterior 1/3 is derived from cranial part of hypobranchial eminence. cranial part of hypobranchial eminence. It is also known as cupula. Cranial part of hypobranchial eminence is also known as cupula. Posterior most part of the tongue posterior most part of the tongue and epiglottis is derived from caudal part of hypobranchial eminence. Okay, look at that. Parafollicular C cells of thyroid. I'll tell you that. We'll see that. Just wait. These are all ectodermal in origin. Okay, we'll see. So this forms the structure of the tongue. Clear to all of you? So anterior 2/3 of the tongue is derived from which pharyngeal arch? First pharyngeal arch. Develops from two lingual pharynx and tuberculum impar, which is the nerve of the first arch, mandibular nerve. So who supplies the anterior 2/3 of the tongue? A branch of mandibular, that is lingual nerve. Okay. The posterior 1/3 of the tongue is derived from the cranial part of hypobranchial eminence. Which arch is this? The third arch. Nerve, glossopharyngeal nerve. And the posterior most part of the tongue and the epiglottis is derived from the fourth pharyngeal arch. The nerve, superior laryngeal nerve. Okay. Clear to all of you? So this forms the structure of the tongue. The muscles of the tongue are derived from, this muscles of the tongue are derived from. Muscles of the tongue are derived from occipital myotomes. Occipital myotomes. Muscles of the tongue are derived from occipital myotomes. Clear to all of you? Okay, just one last thing. Diagram you want? Yep. That's a diagram. Posterior 1/3 is supplied by glossopharyngeal nerve. Glossopharyngeal. Diagram I'll put. Okay, just one last thing. Understand this now. Development of face. Okay, you get some MCQs on this, so be clear. Development of face. Just 5 minutes. Concentrate. Myotomes, myotomes. I've just told you myotomes. Occipital myotomes I've just taught before the break. Okay, just 5 more minutes. Have a look at this. So this topic would be done. Just 5 minutes. Just wait. Look at this slide. Chalo, we'll start. Now tell me, what was this now? Development of face are just the MCQs I'm telling you. That's the procaudal plate. That's the neural tube. That's the neural tube. That's the heart. That's the mouth, procaudal plate. That's the neural tube, the developing brain, and that's the developing heart. There's no neck, no neck. And now the first pharyngeal arch comes here. The first pharyngeal arch comes here. And the first pharyngeal arch divides into 2 maxillary processes and 2 mandibular processes. So this maxillary and mandibular processes are derived from first pharyngeal arch. You following this? That's the mouth, procaudal plate. That's the neural tube. That's the heart. The first pharyngeal arch comes here divides into two maxillary and two mandibular processes. Okay. Now this is a neural tube here. That's a neural tube, and the mesoderm overgrows the neural tube. The mesoderm overgrows the neural tube and forms a process here. What is this process known as? Frontonasal process. Just concentrate 5 minutes. I'm finishing this. This is the frontonasal process. So frontonasal process is derived from the mesoderm overgrowing the neural tube. Now we have got one frontonasal process, two maxillary process and two mandibular process. Okay, one frontonasal, two maxillary and two mandibular processes. The mouth, the procaudal plate or the mouth here is surrounded by one frontonasal process. These are the two maxillary process, and these are two separate ones like this, mandibular process. Okay, fine, this much. Now the two mandibular processes comes closer and they fuse. Okay, so the two mandibular processes fuse here. Look at that. This is the mandibular processes. The two mandibular processes fuse here. They form the lower jaw and the lower lip. They fuse. Okay. Look here, what are the 5 processes which takes part in the formation of face? One is the frontonasal process, this is the maxillary process, and that's the mandibular process. The two mandibular processes comes closer and they fuse, they form the lower jaw and the lower lip. Now what are we left with? We are left with one frontonasal process and two maxillary process. Fine. In this frontonasal process, we get the formation of two small depression here. What is this depression for? Nose. This is the depression for nose, and this is what we call as the nasal pit. Nasal pit. So in this frontonasal process, we get two depressions here. That's a nasal pit. At the moment there's a depression here, the mesoderm becomes elevated. The mesoderm becomes elevated here. There's an elevation. On this side, we call this as the lateral nasal process. Lateral nasal process, and this is what we call as the medial nasal process. Medial nasal process. Okay, so this lateral nasal and this medial nasal process belongs to what? Frontonasal process. Following? Look here once again. In this frontonasal process, we get the formation of two depression here for the nose. At the moment there's a depression here, the mesoderm becomes elevated here. On the lateral side, this is what we call as lateral nasal process. On the medial side, it is known as medial nasal process. So this lateral nasal, medial nasal processes belongs to the frontonasal process. Frontonasal process. Okay, look here once again before I start. This is the frontonasal process. The frontonasal process, this is the lateral nasal process, and this is the medial nasal process. This is the maxillary process. And this is the mandibular process. I am teaching something. Don't you understand? Again and again you are asking me. Don't you understand this? I am teaching something. Just concentrate now. I show you the slide or I teach. Again and again you are writing this. Okay. I'm telling you something. Don't you understand? Like you're typing and typing. Don't you understand this? Okay. So now what is this now? This is the frontonasal process. This is the nasal pit. This is the lateral nasal process. That's the medial nasal process. These are the two maxillary processes. The mandibular processes are fused. Okay. I start here now. The two mandibular processes fuse. They form the lower jaw and the lower lip. Now, the two maxillary processes are coming closer, and as the two maxillary processes are coming closer, the two medial nasal processes comes closer. Look at this line. This is the medial nasal process. This is the lateral nasal process. Okay. Look at this slide and look at this slide. Look at this slide. The two maxillary processes are growing towards the midline. They are growing towards the midline. And as the two maxillary processes grow towards the midline, the two medial nasal processes, they come towards the midline. Look, the two medial nasal processes are coming closer. And as the two maxillary processes comes very close, the two medial nasal processes fuse and they form what? What do they form? They form the philtrum of the upper lip. Philtrum of the upper lip. So philtrum of the upper lip is formed by the fusion of two medial nasal processes. If this two medial nasal processes does not fuse, you get a cleft right in the midline, and this is what we call as a midline upper lip cleft. Midline upper lip cleft. So midline upper lip cleft is due to non-fusion of two medial nasal process. Okay. After this, the maxillary process will come and fuse first with the medial nasal process and then it fuses with the lateral nasal process. If the maxillary process does not fuse with the medial nasal process, again we get a cleft here. But this cleft is not in the midline. This is at a side here, side. You've seen a rabbit has got a cleft here. It can be unilateral or it can be bilateral, and this is what we call as a hair lip. So hair or a rabbit cleft lip is due to non-fusion of maxillary process with the medial nasal process. Okay, and last, the maxillary process would now fuse with the lateral nasal process. If the maxillary process does not fuse with the lateral nasal process, we get a long cleft extending from the eye to the lip here, and this is what we call as an oblique facial cleft. Okay, so oblique facial cleft is due to non-fusion of maxillary process with lateral nasal process. Okay, this is what you're supposed to know. Just have a look at this. Look at this once again. What is this process? Maxillary process. What is this process? Mandibular process. What was this entire thing here? Frontonasal process. What is this process? Lateral nasal process. And what is this process? Medial nasal process. Medial nasal. Okay. So I'll just write this down and then you see this slide. I'll just write this down. Okay. And then you see the slide. Fine. Midline upper lip cleft. Midline upper lip cleft. Non-fusion of two medial nasal process. Second, hair lip, also known as, I'll explain this once again, cleft lip. Hair lip or cleft lip. I'll explain this, just 5 minutes, I'm finishing this. Non-fusion of, so head and neck is over. Non-fusion of maxillary process with medial nasal process. Maxillary process with medial nasal process. Oblique facial cleft. Non-fusion of maxillary process with. Heading is development of face. Development of face. This is development of face. Non-fusion of two mandibular process. Heading is development of face. Yes, all the pictures will be there. Non-fusion of two mandibular processes. 5 processes which takes part in the formation of face. One frontonasal process. And what are the 5 parts of frontonasal process? Medial and lateral nasal process. Two maxillary, two mandibular. Two maxillary and two mandibular process. Okay, so this is development of face. Okay, so look here once again. What are the 5 processes which takes part in the formation of face? This is the frontonasal process. Frontonasal process is derived from the mesoderm which overgrows the neural tube. That's the frontonasal process. This is the maxillary process and this is the mandibular process. So maxillary and mandibular processes are derived from the first pharyngeal arch. So the 2 mandibular processes fuse, they form the lower jaw and the lower lip. Now what are we left with? We are left with 2 maxillary process and 1 frontonasal process. In this frontonasal process, we get the formation of 2 small depression for the nose. This is known as nasal pit. The moment there's a depression there are 2 elevations on either sides. On the lateral side, this is known as lateral nasal. On the medial side, this is known as medial nasal process. Fine. Now the maxillary process comes closer, and as it comes closer, the 2 medial nasal processes comes close, they fuse and they form the philtrum of the upper lip. So if these 2 medial nasal processes do not fuse, you get a cleft right in the midline. That's a midline upper lip cleft. Okay. Now this maxillary process will first fuse with the medial nasal and then with the lateral nasal. If the maxillary process does not fuse with the medial nasal process, again you get a cleft here, but this is not in the midline, this is at a side. It can be unilateral or bilateral, and this is what we know as a hair lip or cleft lip. And the last, the maxillary process, if it doesn't fuse with the lateral nasal process, you get a long cleft extending from the eye to the lip. And this is what we call as oblique facial cleft. Oblique facial cleft. Frontonasal process is by the mesoderm. Mesoderm. These are all mesodermal anyway. Mesoderm overgrowing the neural tube. Clear to all of you? Fine. So we'll stop here. Take a lunch break then. See this slide. You tell me what is this? What is this? Third arch. All these landmarks now, how many weeks and all, I'll give you a separate table. Okay, what is this? You tell me. Hair lip. This is a hair lip. This is a hair lip. This is a unilateral hair lip. If it's on this side, it's a bilateral hair lip. It's a bilateral hair lip. Okay. If this is in the midline, this is due to non-fusion of 2 medial nasal processes. If it's in the midline, this is a unilateral hair lip. Unilateral hair lip. Look at this slide. Look at this slide. Sorry for that. What is this now? This is a midline upper lip cleft. This is a midline upper lip cleft. What is this? This is a hair lip, unilateral hair lip. This is a bilateral hair lip, and this is an oblique facial cleft. Oblique facial cleft. Okay. Fine. This is an oblique facial cleft. Clear to all of you? Fine. You take a break then. I'll start at 3 o'clock. It's 2:15.